Ready? Good morning, everyone, and welcome to the Board of Supervisors meeting at San Benito County on November 17th. It's 9 a.m. Call the meeting to order. Can we all rise for the Pledge of Allegiance led by Supervisor Peter Hernandez?
Ready? Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Supervisor Hernandez. Can I have a motion for a certificate of posting?
So moved, Mr. Chair.
Second it. All those in favor say aye.
Aye.
Opposed, hearing none. We'll move on to the ground rules. Ms. Rodriguez?
Good morning, everyone. For those participating by Zoom wishing to make a public comment, please go ahead and press star 9 or the raise your hand icon. Please also state your full name for the record. Each person will have 3 minutes to speak. Thank you.
Thank you, Ms. Rodriguez. I don't see any presentations or recognitions, so we'll move on to public comment. This is the opportunity for the public to comment on items not on today's agenda. You have 3 minutes, and we have the first speaker.
Yes, hi, good morning, Chairman and members of the board. My name is Veronica Lizama, employee at the Counsel of Government's office, as well as chapter president for SEIU Local 521, representing San Benito County employees. So as we enter our first day of the Tier 1 Purple of the color-coded coronavirus system, I'm here on behalf of your San Benito County workforce to inform you that we are ready to continue to serve our residents and support the board. And as we continue to move through this pandemic together, we ask for your support for a fair and just contract for your employees, which is on today's agenda, that reflects their hard work and commitment to our residents. So with that, I thank you in advance. Thank you.
Thank you. Next speaker.
Good morning, members of the board. My name is Regina Valentine. I also work at the COG office, but I am also a member of the SEIU bargaining team. So as you know, we're in the process of contract negotiations. I want to ask you today for your support for a contract that reflects the vital services that we, your county staff, provide the community. We greatly appreciate the support you've provided us in the past, and thank you in advance for this bargaining cycle.
Thank you.
Good morning, board. This is Christina Chavez. I work for the assessor's office. I'm also the vice president of SEIU and a steward. And just wanted to let you know that I support our bargaining team's offer at the table, and I hope you guys do as well. I think it's a fair contract, and you know, all of us employees are just looking forward to continue focusing on serving our community. Thank you.
Thank you.
Good morning, Elia Salinas. I am not employed by the county. I've never worked for the county, but I do implore all you supervisors to remember that these are some hard times, and we need to also work diligently to keep the employees that we have. I've come up here numerous times and state that we need to pay adequately to these county employees so that they can stay here for the long term and not use this county as a stepping stone, so they can get the experience and go on to another county that's going to pay more. We have the fire department that we have a contract with. We have the sheriff's department that I encourage that we need to, we're low, or I don't want to say man, because we need some women deputies out there as well. But we need to hire more first responders. We need to keep the staff that we have, and we need to try to recruit individuals to want to come and work for San Benito County and live in San Benito County and have a decent living wage. Thank you.
Thank you. Anyone else from the gallery?
Richard Betancourt, 4140 Southside Road. I just want to thank the board and the road department for the road between the bridge on Southside Road to the low water crossing in Tres Pinas. And also my car wants to thank you too. Not shaking apart now. Thank you.
Okay, thank you. Any other speakers from the gallery? If not, we'll go to the Zoom. Ms. Rodriguez?
Members of the public who wish to speak on items not on the agenda, please raise your hand by pressing this raise your hand icon or *9. Courtney, please state your full name for the record. You have 3 minutes to speak.
Good morning. My name is Courtney Evans, and I would like to speak on our recent election. We have put these in as public records. I would like to reiterate that it is not our intent to question the integrity of the people, but we do have questions in regards about the system. So I think that this would be something to put and discuss on an agenda item to make sure that our public requests are adhered to in a timely manner, that we were curious of where the ballots were counted and tabulated by hand, what software system is used in counting and tabulating the ballots. Were we using the Dominion voting system or any subsidiaries of the company? Were the votes tabulated on a local computer? Were votes tabulated online? Who has control or runs the online program? So there's just a lot of questions of where, how, reports. We would like daily statistics of counts, and hopefully we can work together and continue to be transparent. Again, I would like to reiterate that this is not our intent to question the integrity of the people and the hard work that they did during our election. If you recall, a few weeks ago, there was a lot of COVID money that was allotted to our voting for our elections department. And so we just want to keep this transparent, open, and make sure that our people in the community are answered the questions that we've asked, and the transparency is clear in regards to this recent election. Thank you guys very much.
Thank you very much for your comments. Anyone else?
We have no more public comment via Zoom at this time.
Okay, at this time, I'll go ahead and close the public comment period and move to department head announcements. Mr. Espinosa.
Thank you, Mr. Chair. Yes, we have an announcement out of our county counsel's office.
We're going to be polling item. It's going to be continuing the item number 20 to the next meeting so that we have all 4 supervisors present.
Item 20 is to be continued.
Yes.
What is the reason?
So I can have all 4 supervisors present at the next meeting.
Item 20.
It affects everybody.
Okay.
The other guy is meeting. Is that really, I mean, we'll be here.
Right.
In December, he'll be here.
No, I mean, he's leaving. He's not going to be a supervisor as of beginning of the year, so what's the difference if we do it now or do it then?
Yeah.
I'm just curious what,
Yeah. I think it's hard to do just a 3-person board. Right
but
now.
all these other items are on here and there's a
Right, but this
3-person
one might
board.
be more, it might not,
Well, the sublease is on here, so is the,
right.
okay, well, that's,
Yeah.
you can pull it.
Okay. Any other items? Okay.
Out of the county counsel's office, no. There is an item that was brought to my attention from the clerk's office about item number 3 on consent. I think that there was some cleanup, additional cleanup that needed to be done. So we're going to actually remove that item and put it on another board meeting, probably in December. Yeah.
What item is that?
Item number 3,
Is that the fishing game?
fishing game. Yeah.
I heard.
And also, it looks like item number 10 requires a 4/5 vote.
That's what I was kind of looking for just now, if you need 4/5 votes, there's a couple of them here.
I could see moving that one.
Okay,
Number 3, number 10, and,
and 20.
and scrapping 20.
All right. We have that. Any other department head announcements? That's it?
That's all, Mr. Chair.
Good. We'll move on to board announcements. Supervisor Medina?
I know nothing has been certified in the election, but just want to recognize an individual out in the open there. Congratulations, Colin. Same thing to Mr. Tiffany, who is online, and our elect supervisor, Mrs. Gonzalez. So we'll look forward to working with everyone in the next year, and let's make 2021 something to be proud of. Thank you.
Supervisor Hernandez?
Yeah. I wanted to agree with Supervisor Medina's sentiments. I know there's a lot of work to be done, so we have to learn to work together to make that happen. As far as board member reports, we had the grand reopening, really exciting, a lot of support. Community members were ecstatic. You know, there's always going to be folks that disagree with things, but I think part of it is lack of understanding because of the reverse parking, and for most people that didn't know, the traffic study actually was the directing point of why the importance of reverse parking was to happen. Well, for one, is there was support from the business community to have a bike lane right down the middle, and that bike lane wouldn't have been possible without reverse parking because of the safety element. When you drive out of your parking stall, that you're seeing in front of you, you know, not only vehicles but bicyclists. So it's for their safety, but it's also for the safety of the actual driver. So when they park, they can unload out of the back of their vehicle, or if they have little ones, they could, you know, instead of running out into the street, they're running onto the sidewalk. So it's just, for all intensive purposes, it's a lot safer. And then obviously with the 50-mile-an-hour speed limit and the stop signs in between every street, all the numbered streets, it's just it ended up being a really good design. I really believe it's going to encourage a lot of success. Nonetheless, we've had, you know, the recent turn of events, which I know we're going to talk about, so I'm not going to be exhaustive about it, but just a lot of concerns with this governor and his changing of the rules again, literally eliminating the 14-day buffer, giving no real hope for opening again according to his rules. This is not even just about a plan. This is just about shutting down with no indefinite answer as to when we're going to open up. Because the moment you break the markers that he's set from before with the safer blueprint, you officially now revert back. So there is no buffer to be able to say, hey, if there's a little bit of a spike, but then you see the numbers level off, then you still have a chance to still stay in that same tier. So stability is not in this plan. It's actually by default opposite of stability, and that's what the business community needs, and that's really, really frustrating to me. So I have a plan that I'd like to share with the supervisors, and I'll share it once we get the report from Tracy, our Director of Health and Human Services. And then I also wanted to see if it was possible to bring back, because there was a question about the integrity of the elections. I do have concerns. I know that there's concerns with the Dominion system. Again, not the people themselves. I've said it from before, but the Dominion system is very questionable. And the recent opinion from the judge actually upholds that, because it basically declares that he didn't have the authority to do what he did and to allow the Secretary of State to change the ballot system into a mail-in ballot only. And so all things considered, she actually highlights in that, specifically in the opinion, that says he unconstitutionally changed the mail-in ballot system, which even mentions an injunctive relief at the end of her opinion, where she mentions possibly having a special election to rein back in his authority, according to the Emergency Powers Act rules. So there's actually a chance that they're going to have to do a special election to address that. So anyway, so I'd like to see if we can bring back some reports, specifics on the Dominion system, what it entails, what are the questions and the irregularities, and how that pertains to our local elections and even our national or state elections. I think with this can't be a let's move on conversation. I feel like we have to have a thorough conversation to address it. Those are my comments, Mr.
All
Chairman.
right. Thank you very much, Supervisor Hernandez. I, too, want to congratulate Supervisor-elect Kosmicki and Supervisor-elect Tiffany, but I'm really looking forward to seeing what this new board do next year and wish them, you know, the best of luck, and I'm sure that they'll be coming with some real good new ideas, and I really am optimistic that we still keep going in the right direction. So I really want to wish them good luck with that. I too was at the ribbon cutting downtown. It's on Saturday. It just goes to show that the county and the two cities could partner for good projects that brings benefit to the whole community when we're working together. And with the CARES Act, working with Supervisor Hernandez, who did really an outstanding job with his speech during the opening, demonstrating that we can work together, and that's what I'm really optimistic for next year, that that spirit will continue to go forward, and that as we kind of fight our way through this COVID, I share the same concerns as Supervisor Hernandez about the business community being turned on and turned off under the circumstances that sometimes are outside of our local control, but it needs discussion, that's for sure, and how we're going to assist, businesses and their employees and the whole community going forward. We have to think this thing out. But with that, I'll move on to the consent agenda. We are pulling item number 3 and 10 to continue to a future meeting. Is there any other items that this board would like to pull? Seeing none, are there any items that the public would like to pull?
Good morning, Elia Salinas. I would like to pull item 2, 4, 7, and 15.
2, 4, 7, and 15. Okay. Any other, please step forward.
Yes, I have a question about number 9, for further discussion
Okay.
or information.
Okay. Anyone online?
Members of the public who wish to pull an item, please raise your hand by pressing *9 or the raise your hand icon. Alan, please state your full name for the record. Alan, you have been unmuted.
Yes, I'm online. Can you hear me?
Yes.
Hello? Can you hear me?
Yes.
Alan, we'll wait for you, Alan, on the item. He's a director for the county, so he's going to be discussing item number 2, or be ready to answer questions for number 2.
Okay, all right, great. With that, I'll entertain a motion for the amended consent agenda.
So moved, Mr. Chair.
Second.
All those in favor say aye.
Aye.
Opposed, hearing none. We'll move on to item number 2. Ms. Salinas, if you want to step forward, ask your question or comment.
Thank you, Supervisor BOTELHO. I think I just broke this. So it says that we're here to renew the contract not to exceed $94,000. I would like a report. The public needs to know, or should know, how many patients from San Benito County are using this facility, for how long a period of time, and what is the cost at least the average cost for patients using this facility. Thank you.
Thank you. Director Yamamoto, could you respond to any of that, please? Maybe you can.
Is he on mute?
No.
Alan?
Can you hear me?
No, we can. Go ahead.
Yeah, can you hear me?
Yeah.
Okay.
Yes.
So, yeah, as I was trying to say, we have many contracts like this because we have to have multiple hospitals available to us because the beds are so difficult to find. There is a statewide bed shortage that we're incurring, and it has gone on for some time. So the predictability of how we use these facilities is unpredictable. We go down a list of available facilities and our contracted facilities until we find a bed, because our priority is to try to get our clients moving as quickly as possible. And particularly, it's an additional concern because we want to move them out of the Hazel Hawkins ER also for their sake as quickly as possible. I don't have the exact utilization on this facility available for you, but I can tell you it's probably used very little. The dollar amount you see is not relevant to what the actual utilization might actually be, because we have no predictability on utilization. We put in an amount that we think is safe to be within a cap that we could hit, but we probably will not hit the cap on this particular facility. One of the reasons why is because it is a distance away, but we still need the options. Plus, I believe this facility was also a facility that served multiple ages, including adolescents, and there's a particular shortage for adolescent beds. For example, our neighbor county, Santa Clara County, has never built a psychiatric hospital for Santa Clara County, so you can imagine the pressure just one county like that puts on this bed use. So the cost of the beds, it's approximately, let me flip through here to my pages. About $979 per day, per bed day. Now, if the client has Medi-Cal, 50% of that cost is actually reimbursed back to us at the end of the year through Medi-Cal reimbursement. So it actually works out to be a very good rate for the clients that do have Medi-Cal. Of course, for those clients that don't have Medi-Cal or any other insurance payer, we do have to pay the full amount. And these are mandated services that we have to have available for clients that are in psychiatric emergency. I hope that answers all of your questions. If you have additional questions, I'd be glad to try to answer them for you.
Okay. I see kind of a head shaking, but perhaps what we could do is maybe kind of bring Ms. Salinas and Mr. Yamamoto together.
I'll take this on. I'll meet with Elia, and then we'll converse, and we'll try to get a email or something out to the director and take care of that. Does that satisfy that, Elia? Okay.
Okay, that'd be great. So any other public comment on item number 2 on the consent? If not, I'll bring it back to the board.
Make a motion to approve the contract renewal of BHC Heritage Oaks Hospital for a maximum amount not to exceed $94,000 through the term of July 1st.
Okay, I have a first and a second. All those in favor say aye.
Aye.
Opposed? Hearing none, we'll move to item number 4. I think Ms. Salinas, you had a question on that too.
Just for public knowledge, not everyone has access or knows how to have access to open up the agenda packet. So I would like publicly to know be read, what is exactly is being amended? Thank you.
Thank you. Mr.
I can-
Espinosa?
Yes, I can handle that. So, back in February of 2019, your board, with staff, had a board retreat to discuss oversight over department heads and staff. And there were a lot of ties with the hiring process with the board and the CAO. So your board missioned staff to clean that language up and to have the oversight done by the CAO. Obviously, there were 3 positions that still report to the board. That's the CAO, County Counsel, and our Ag Commissioner. Those are the 3 positions that still report to the board. This is a form of cleanup language to that direction that your board had given us before. So in essence, what this is saying is that this position now reports basically to the CAO, and that's really the language there. So.
Okay, great. Any other questions from the public? Seeing none, any more comments or questions from the board or a motion?
I make a motion to adopt the ordinance amending sections 3.01.140 regarding the clerk of the Board of Supervisors.
Second.
All those in favor say aye.
Aye.
Opposed? Hearing none. Thank you. We'll move on to 7. We had a question from the public from that, or?
Yes.
Oh, okay. Let's step forward and see if we could clarify this 7.
First of all, I want to clarify what I'm asking here, because what is going on with the way that the agenda is written, I realize that sometimes they get really long, but if you can have more language so it can be transparent to the community. That's why I'm up here asking specifically, because you're just putting it out there and people don't know how to look for it. And if you can just put more information, then they won't question that something is going on, because that's why I'm voicing this opinion. People have been complaining.
Ma'am, are you referring to the attachments?
I'm just referring to public, just
In
why
general,
I'm here.
in general, okay.
And in regards to item number 7, I was totally against the 20% increase of the ambulance service contract. And I said back then that most people are 2 paychecks from losing their homes, and it's come to fruition, unfortunately. I'm concerned that it doesn't say that there's an increase, but has it been a year since we already approved this? I don't recall that it was a year. It's been a year, so I'm curious as to why we're doing an initial 180 days for the contract. Was it not for per year, the original contract, or am I misunderstanding this? I'm still against the ambulance company having gotten that 20% increase. You have your county staff requesting for a pay raise, and it's nowhere near 20%, and now we're dealing with a contractor that gets that much. So I don't want an outside agency that I know that we use, but they take advantage of us, and we were stuck and we didn't have another opportunity. So please explain, what is this contract extension for? Thank you.
Thank you. Director Bencano, I think you'll be able to answer that. I know we've been working on this for a while. It's been on our agenda, and the ambulance service is kind of a real problem for a number of the counties in our region.
So the contract from AMR, our 911 ambulance provider, expired the end of September. That was we had a 1-year agreement with them while we wrote a 5-year contract. COVID has delayed the extension of that or writing the new contract. So we're requesting a 120-day contract just to get us to that 5-year point to bring that to the board. There's no price increase involved in the 120-day extension. That extension that price increase was brought to the board in January. They do request per their contract, or they're able to request per their contract every January an increase. So that's when they brought it. So that price remains through this 120 days.
Okay.
Any other
Thank you.
questions?
Any other questions? All right. I
Thank
think
you.
that will cover it for right now. Any other comments from the public?
When my brother had COVID, he was sent to the hospital 3 blocks from his house, $4,000. I thought that was a little ridiculous, but coming from a business background, we got to understand, I don't know how many professional EMTs they have on duty 24/7, 365 days a year. So I don't disagree with the cost of doing that business. In other words, it's extremely costly.
Okay.
So maybe 20% is okay, I don't know.
Thank you. Any other comments from the public? No one on, from Zoom? All right, I'll bring it back to the board for any comments or discussion or a motion. Go ahead, Sue.
Yeah, Ellie and I don't always, we don't disagree a lot, but on this one, I look at it, Ellie, as saying AMR is a crucial part of our community. I converse with them at least monthly. I think the staff that they have is phenomenal. I rely upon them for any type of emergency services, and they are part of this community. And when I look at a contract like this, we have to make sure that we work together, just like the fire department, just like the sheriff, just like the police department. They are instrumental, and I tip my hat off to all the EMS people and AMR, and our emergency services. Thank you.
Any other comments? And I want to echo that. I've worked on this contract through the years, sitting on this board, and it's always difficult for everyone to meet their costs, and they've worked with us as far as trying to hold costs down and build insurance companies and get alternative funding, and it's getting more challenging as time goes on. The medical services are, as we all know, are affected with our medical rates or people that don't have it, and ambulances are an essential part of what we need to provide, and their costs are going up and we just have to try to work together, and that will be one of the new challenges for the new board members coming this coming year. So, but I think they're sensitive as far as our rates as well and its impacts on our citizens. With that, if there's no further discussion, I'll entertain a motion.
Make a motion to approve the emergency medical services 911 ambulance contract for 120 days effective today, November 17th, 2020 through March 18th, 2021, and enter into an interim limited term agreement to continue provisions of services and provide for a period of time from the expiration of the prior agreement until effective date of this agreement.
Okay.
Second.
All those in favor say aye.
Aye.
Aye. Opposed? Hearing none. Move on to item 9. We have a question on item 9. Oh, Judy.
Yes, hello,
Morning.
I'm Anita Kane with Reach San Benito Parks Foundation and also the Historical Society. And I have a question about reallocating over $85,000 that was approved for a FEMA loan for the restoration of the north end of the historical park. that end of the park was devastated by the floods, and it's been closed to the public since that time. And that money, I believe, would go a long ways towards addressing the public's use of that space. I see in the reallocation request that it says the money is not being put to the best use by doing the FEMA repairs, and I would ask that you reconsider this. $85,000, if you partner with some of the restoration groups that would work with you on this, you could make that money stretch out a long ways and address the end of the park, or the north end of the park damage, and allow the public to use it again. Even with the COVID situation out there at the park, we see a lot of people coming out there and, wondering why it's in such rough shape out there at the county end of things. And I'd really like to see people being able to utilize it again. And I would hope that you reconsider the use of taking away the $85,000 and put it back where it belongs in restoring the riverbank there and allowing people to use it again. Thank you.
Thank you. Any other comments from the public? If not, I'm going to bring it back to the board for some discussion, because I'm happy this got pulled, to be honest with you. I'll recognize Supervisor Medina first.
Hi, just a real quick question. I know this is purchasing a dustless blasting pot with the electric operating system, air compressor, water tank, water pump, drying cooling system, mounted on a trailer. How often would we use that?
Can I start with addressing the funds?
Oh, sure.
that were
Sorry.
reallocated?
Sorry about that. Yeah, go ahead.
Sure, just to give you a little more background. So the RMA Roads Department feels they can repair the part damaged to the satisfaction and to the pre-flood presence. So they will be fixing that. They don't need the additional funds to do that. The funds were allocated by FEMA to put little signs on trees that state what the tree is, and different things like that, and they don't feel that that will benefit the park to its original state. So they feel they can use this sandblaster to help remove graffiti that is a problem in the county, and they have documented how many times that piece of equipment would have been essential.
So just with the FEMA allocation, how long do we have these funds before they have to be spent? Or what I'm asking here is, RMA has stated they can repair park back to normal.
Yes.
Before we spend these funds on anything, I'd like to see that park repaired.
Sure.
And then we can use these
they're-
funds.
They were waiting for the weather to improve from the heat so they can get out there. So I think now would be,
Well, yeah, that's what I'm saying, but I don't think we should spend this is my opinion, I don't think we should spend any of this money until that park is back to where it was prior to the 2017 flood.
I can bring that back to the RMA.
That's all. Thank you.
Thank you, Supervisor Hernandez. You have anything to add?
Yes, Mr. Chair. I would agree with Supervisor Medina. I mean, it's in this day and age of COVID and the rules and outdoor being an opportunity, and agreeing that there's a lot of beauty to our community that we need to keep focused on. I'm not opposed, obviously, to removing graffiti. I think it's a good idea, but I don't want it to hurt any momentum of preserving our parks, because in my mind, preservation of parks isn't just something of like a maintenance need. It's like restoration really is I think what needs to happen, which means funds need to be focused on what we could multi-purposes. Parks now, with outdoor recreation being still an opportunity for San Diego County and tourism, we need to, if there's a way to prioritize that and still use the funds to support the needs like graffiti, which I totally agree with Chris, I think it's a good idea. I just want to make sure we don't put parks in a back seat.
Sure.
I think they need to be prioritized for sure.
And this is excess funds that they don't feel they need? This isn't the whole FEMA allotment?
Okay.
Okay, and, I don't know if Director Young has have anything to add as well. But I was kind of concerned about this, and I don't know if you've had an opportunity to go out to our historical park, but it's a very nice park, but it really needs some resources and funding to make it really what it should be. And, you know, I understand the importance of buying equipment when you could get equipment, but maybe the money might be better spent putting it into the park, but maybe you could justify the request.
Mr. Chairman, members of the board, thank you, Chris, for your work on this. I think I'm okay with the motion. I don't know the details yet. I've seen the park. I think it's a wonderful asset for the community, and it makes sense to make the repairs to make sure we can get that done before we spend the FEMA money on the equipment, as far as I'm concerned. My only question would be, are we on a timeline with the FEMA funds that we're going to miss the opportunity for reimbursement? That's my only concern.
We are, but we can work with that.
Okay. Very
Okay,
well.
great. I think we're on the right track.
And, the only other request, if it's okay, Mr. Chair, I was just thinking to make sure to include, maybe, the cheer folks, just to, you know, ultimately, so that way there's good dialogue as far as the expectation. And I am pretty sure they'll come back and report to us kind of what happened and how the park is gonna be revitalized.
Yeah, I think it's a
Ma'am?
have to happen that way.
Ma'am, do you approve of that?
Yeah, I think bringing cheer into it is great, but I think there's other,
Please step to the podium. I think we want this on record.
Yeah, Cheer does great work, and I'd love to see them in on this too. You know, Reach Parks Foundation is willing to make connections with
I
other
was,
conservation groups that can do
I
this.
apologize.
You meant Reach. You meant Reach.
Herman Garcia was in my head, but Reach
Uh-huh.
was on my lips. I
Well,
was intending on
We're all
mentioning Reach.
willing to help, you
Yeah.
know, and so please
Well-
bring us in on it. So.
You know,
Yeah.
once again, ma'am, I just want to say thank you for bringing this to our attention.
Yeah.
Perfect example of the community questioning things that we have up here.
Yeah.
And
There-
bringing this to our attention really opened up the eyes of
You
us
have resources out
members.
here, and
Yeah.
just
But
Yeah.
let us
I appreciate
be in the
it.
loop. Yeah,
Appreciate
thank
it.
you.
Yeah, so a little correction, RMA director, yeah, if we can involve Reach in the conversation, please. Thank
Well,
you.
yeah, you can make the motion.
Okay, thank you. Do we need to have a motion on this?
Yes.
Probably an amended motion.
Okay, can you
Yes, you
restate
do.
the motion? Just so everybody, it's clear.
So an amendment to item number 9, Mr. Chair, if we can approve the resolution, the reallocation of FEMA funds, subject to the historical park being prioritized, the maintenance needs before the reallocation of funds, and including Reach with the reporting element of that amendment.
I second.
Okay, all right, I have a motion and a second. All those in favor say aye.
Aye.
Oppose? No opposed. And we have one more on consent. This is item 15. Ms. Salinas again?
Again, just for clarification for public knowledge, and is we could have included in here with no increase in the contract, in the original contract amount of whatever, because it doesn't state how much the amount is original contract. Could be $1, and I'm sure that it's not. When it says approve the amendment number 3, is this the third time we're amending the contract? How long has the contract been existing for? And is this a 2,080-hour contract that they're giving us hours a year? Or are they only giving us 30 hours a year? Why is it taking so long? If it's been amended for 3 years, why are the architects taking so long to come up with a plan? Because if it were stated on here, I wouldn't have that many questions. And I'm just up here because I want it to be transparent to the community that we're not doing anything. And I know that the county's not doing anything behind anybody's backs. It's just we need to just put it there so that people can read it and they don't question you. Thank you.
Thank you.
Thank you. Mr. Young?
Mr. Chair, members of the board, Mr. Espinosa, this contract was actually approved 2 years ago, and it was in the amount of $322,431 originally. I have Damon Felice standing by who can answer specific questions with regard to the project. It's nearing completion, And we're really excited about it. It's a great asset also to add to the community, and the work has been outstanding. I believe that the answer to the reason for the extension is that there's a little bit of construction mop-up work that needs to be done, and the architectural firm is also assisting with contract administration for the construction work. So Damon, if you need to add information, please do. Damon Felice.
Thank you.
Thank you. No, those are all, that's the case. We're going to go through move-in and punch list and close out, and, it's going to be extended by a few months. So to answer the original question, we're not increasing the contract amount, or it's just a time extension. There's not money associated with that time extension. It's just going to take, because of some front-end delays, it's causing some delays on the back end. So that's all that contract is.
And Mr. Chair, thank you, Damon. The only thing I would add is this was a full-service contract for design as well as construction administration. So that's why that dollar amount seems a little high perhaps, but we don't have architectural services on staff, so we needed the assistance of a contractor to get that done for us.
Okay.
Mr. Chair, if I may as well, I just wanted to add that the actual contracts are all inside the staff report. If you look at it, it has all of the amendments, and it has all of the dollar figures in that staff report. So it does state what those figures are. I just wanted to be clear with the board on that.
You're speaking of the attachment, correct?
The attachments, that's correct.
Yeah.
Okay, any other questions or comments from the public? No? I'll bring it back to the board for an action or
Make
comment.
a motion to approve contract amendment number 3 for Behavioral Health Center project to extend the existing contract until July 31st, 2021, with no increase in the contract amount.
Second, Mr. Chairman.
All those in favor say aye.
Aye.
Aye. Opposed? Hearing none. We'll move on to the regular agenda, our favorite topic. Number 18, receive a presentation and update from Health and Human Services and Public Health Services on the respiratory disease coronavirus, also known as COVID-19.
We have Tracy on the line. Tracy?
Good morning.
Good morning.
So I just wanted to provide a brief update on our OptumServe testing site. We do have some good news that the site was extended through April 30th of 2021. So we're working out the details with OptumServe on the hours of operation. Most likely they'll stay the same, but we have secured the VETS building through April 30th of 2021. Just want to provide the update to the board as well as the community. Just a brief update of our testing numbers. Within the last couple of weeks, as we've had an uptick in cases in our county as well as in the state, we've also noticed an uptick in people being tested at the site. So currently we have 200 pending. There was a little lag time because the state switched laboratories, and so there was a little bit of lag time, but it seems to be picking up and we're getting results quicker. So I just wanted to provide a brief update on that. As soon as we iron out the details of the testing site moving forward, we'll present that to the board as well. Next slide. So this is a bit of a wordy slide, but I just, as many of you are aware, yesterday the governor announced that we will be taking an emergency break due to the uptick in cases in the state of California as well as in our county. Unfortunately, our county, along with several other counties, numerous counties, shifted back to the purple tier due to the uptick in cases. And so he noted that the daily cases in California have doubled in the past 10 days with a 51% increase between November 1st and November 7th. So they made some changes. I know Supervisor Hernandez mentioned that the constant change, they did make some changes, which I know is frustrating for everybody. So prior to yesterday, the tier changes were happening on Tuesdays. Now the tier assignments may occur any day of the week, depending on the immediate action that's needed based off of the cases. The counties may move back more than one tier. Initially, it was a one-tier jump. However, now they have advanced some counties back 2 tiers. So some counties, if you looked at the website yesterday, moved from orange to purple. We shifted from red to purple. And it does say that the key considerations include the rate of increase in new cases or the test positivity, public health capacity, and or other epidemiological factors. They may move within 1 week instead of 2 weeks, as Supervisor Hernandez mentioned. That shift, the most reliable data will be used to complete the assessment by CDPH on a daily basis. In light of the extreme circumstances requiring immediate action, counties will be required to implement any sector changes the following day, which is today. So previously they gave us 3 days to shift. With this new change, we have 1 day. So our county must move to the changes in the tier assignment as of today. It talks briefly about tier adjudication. If our county felt that we met some criteria for adjudication, we could request it from the state, and they would assess that as they feel necessary. Next slide. So some key messages that were presented yesterday is California is experiencing an unprecedented rate of increase of COVID-19 cases statewide. Every region in the state has increased. The state's goal is to preserve our healthcare capacity, so making sure that patients have access to care and that we don't overrun the hospitals. You can see that as of November 16th, there are now 41 counties in the purple tier, 11 counties in red, 4 counties in orange, and 2 in yellow, which was a dramatic bump. We do have several schools in our county that are open. If they were open prior to advancing to the purple tier today, they may stay open. However, if a school wants to open in the purple tier, they need to submit a waiver as it was previous. We're just asking the schools to continue to do their surveillance testing as they've been doing. And our school systems have worked very well with us and very closely with us, so we appreciate that partnership. Next slide. Just wanted to remind you what the purple tier changes, and it's industries and businesses that are highlighted on here have to shift outdoors. So there was gathering guidance put out, a maximum of 3 households in a gathering, encouraging outdoor gatherings in general. However, in the purple tier, they're saying outdoor gatherings only. Gyms and fitness centers, including studio sports like martial arts, cheerleading, gymnastics, dance studios, all need to shift outdoors with modifications. Places of worship, movie theaters, restaurants, and all retails, all those industries need to shift outdoors, and then retail, except for standalone grocery stores, need to reduce their capacity to 25%. And those can all be found on the website, on our county website, as well as the governor's covid19.ca.gov website. Next slide. This just shows the 7-day average positivity percentage for our county, as well as the average case rates, and you can see how swiftly it changed and the uptick, and it sometimes is easier to see a picture. Just wanted to present that for you from the tier levels. Next slide. So there's been a lot of questions regarding contact tracing and what it's revealed for us so far. It's important to remember that contact tracing is as good as what individuals are willing to share with us as an agency. Some people don't want to share with us where they've been, which is their right. It just helps us understand how things are spreading. These are some areas that we've noticed household spread. So one family member coming into the household positive and spreading it amongst the household. We've had the family gatherings that have presented positive cases, Halloween gatherings. We've had some individuals report out that they were at a football party watching and tested positive out of there. We've had some positives from work sites, youth sports, and school settings. So we're trying to monitor these and see where the uptick is coming from. I would say the biggest uptick is in household spread. And so it's important to be mindful of that. Just the numbers below just show the rapid, swift change that we had in our positivity rate, and in our cases. And so just to keep that in mind. And this is, again, happening statewide. Thank you. There was a travel advisory that went out, and the governor did indicate that it, and Dr. Galley indicated that it is a advisory. It's nothing more than an advisory, as well as an update to the face covering guidance came out yesterday. The travel advisory is giving some advice on if you do travel, what they are suggesting, which is to self-quarantine for 14 days after arrival. If you're traveling for essential travel, which is work-related or is deemed essential, then this does not apply to you. The face covering guidance, it just updates the guidance to indicate that we should be wearing it as anytime outside of your home. There still is some exceptions to that, which are found in the guidance. I would encourage you all to take a look at the guidance, as well as if you're able to physical distance when you're outside. It's encouraged but not required in this guidance. That was all for the presentation. Dr. Ghilarducci is, I believe, still on the call, as well as public health staff. If there are any questions about our numbers, any general questions for the doctor, we'd be happy to answer.
Okay, why don't we hear from the doctor first before have the board ask any questions?
Oh, good morning, Dr. Ghilarducci here. Tracy, as usual, covered it very well, so I don't have much to add from that perspective. I will say that what we're seeing now, the surge that we're seeing now is actually quite different than the surge we saw during the summer. Rate of increase that we're seeing is roughly double what we saw back then, so I just wanted to put that in perspective. And with respect to hospital capacity, given that we have just one hospital that way sometimes, I did hear a report that Santa Clara County is reporting that many of their hospitals are getting close to capacity already. So we're starting to see some pretty concerning signs in our more urban areas. So big vulnerability here, and I just want to reiterate the importance of
Mr. Chair, can we have him call
following
in
the very
so we
basic
can-
guidelines that we about avoiding guests. So thank you.
Sounds like he's on his Zoom audio.
We missed.
He's actually on his cell phone. He's on his cell phone.
Maybe he's on the Wi-Fi audio, because if you dial in, it's different. Because we didn't hear anything he said. It had no.
You didn't hear anything?
We didn't hear
You
anything.
can't hear me?
Particularly the last part, Doctor. Maybe you want to kind of rephrase what you just said?
Regarding hospital capacity?
Yes, yes.
Oh, yes, okay, I'm so sorry. Santa Clara County is reporting that their hospitals are starting to fill up, so this is a real vulnerability for us, and just reemphasize the importance of following the basic public health measures and that we've been talking about for the last 7-8 months.
Okay. One of the questions I have, Doctor, is that, going through the report, I think everyone's concerned about the increased positivity rate and how fast that has happened. And the contact, in the Tracy's presentation, the contact tracing was revealed regarding the recent uptick. And this is where I'm kind of confused by the governor's order, is that listed here was household spread, family gatherings, Halloween gatherings, work sites, youth sports, and school settings. But we're kind of coming back and we're shutting down, businesses and restaurants and things like that, that I think they put a number of safeguards in that they didn't have in March, April, May. And, the county and the private sector has worked so hard to put in plexiglass, social distance, change the business models for a lot of these businesses. Do we really, as you talk to your colleagues through the state and at the state level, really expect a change in this trajectory of positive rates by going back to purple?
Yeah, that's a great point. I think the bottom line is that if people's individual behavior doesn't change, then most of this is probably not going to be very effective. And I think that's been shown time and again. It's people's choices about whether they want to take this seriously or not, about whether they feel like they can safely gather or maybe, don't feel like they need to wear a mask. All of those things we have shown time and again, nationwide, worldwide, that those are important factors. But, I think it's all, from the state level, the discussions that I've been involved in, it's always about trying to strike the right balance that can keep our businesses alive and surviving, and at the same time try to minimize the impact to public health. And it's a fine line that they're walking there, and a difficult one.
Yeah, and then I have one more question before I ask my colleagues to chime in with some questions. And this past week, we've received, the nation and the world, some real good news as far as some very good vaccines by 2 different companies. And I just wonder what is being worked on at the state level, at least. I think that's where a lot of energy ought to be placed as far as how do we get the most vaccinations to the most vulnerable in the quickest possible manner and in an orderly fashion. And I just wonder if the state is doing anything and expending a little bit of energy on that rather than shutting down everything.
Yeah, thank you for that question. There are pretty aggressive efforts to plan for the vaccine distribution and the storage and all the logistics that go with that. There's a prioritization scheme on when we have limited vaccine, who gets it first. And so a lot of work happening behind the scenes on that, including internally, us being engaged in those meetings and doing some internal planning as well.
Okay, I'm gonna see if Supervisor Medina, if you have any questions for Dr. Supervisor Hernandez. I'm sure you do.
Yeah, I do. And just note, Dr. G, that these comments have nothing to do with you, and I get it, your response to what you feel your duties are to the state and the other health doctors. But in general, this has been super disappointing. There's nothing balanced, and I get that that's what the sentiment is, and I'm not disagreeing that the effort is there, maybe on your behalf, on other doctors, but definitely not on the state side. I mean, there's no rationale to shutting down folks that really aren't the problem. There's nothing logical about it, not one bit. It's by default, if you think about it, right? And you shared it yourself, Doctor. The sentiment is about trying to get folks to understand how to prevent disease, this virus mitigation, wearing masks, social distancing, right? And you're saying, well, and the way Tracy reported, which have heard that, is in homes, Halloween and these parties, and so I've heard all of that. What does that have to do with businesses themselves? If this is about striking a balance, then how are shutting down an economy that pays for mitigation, that ultimately pays for this thing to happen? I mean, at what point in time are we thinking the money's not going to run out from the business community? They're going to shut down. What are they going to do? They're going to backdoor business deals. They're not going to have insurance. How are they going to even be able to go to the doctor themselves? There's all these, it's like for one supposed solution, it's just proving that government is not the solution. It's creating more problems. These protocols are impossible. A tier assignment, at one point in time, I know Supervisor Medina had, tried to emphasize trying to, ultimately balance the positivity rate, making sure that, if people are testing and it's working, then by default, that means that, eventually the case rate will go down because people are trying to mitigate and address. Everywhere I go, I see people wearing masks. Granted, there are folks that don't. To try to force people to wear them is virtually impossible. But that's besides the point. I mean, Now it doesn't matter. Now this positivity rate has really no value because at any given time, your neighbor that does something that you have no control over does something, and you're doing everything that you can, your neighbor could technically be the person that increases this positivity rate. And by default, that means you've done exhausted all your options to try to do what you can and still be punished for it. And the fact that now that buffer is eliminated, so by default, now this governor has eliminated any hopes of really addressing this, right? Why would you even try when no matter what you do, it's not gonna change anything. If anything, it's gotten harder to address, right? So it's putting people in the position to actually not follow through for obvious reasons. So, and if masks really work, then why are we shutting down the folks? You know, I know there's questions about that. I'm not even trying to pose a question against masks, but if that logically is true, which is what you've said many times, doctor, then why are we shutting down businesses that are requiring masks, that are, you know, when you're walking in, you have to wear it. Everybody has a sign. I have a sign in my business. Why is that the case? I don't understand. So these questions are more to the state than they are to you, doctor, because I get it. You're just here to report what you're seeing. But at the end of the day, these protocols are impossible. And to go outdoors now in the time of cold, you're forcing someone to go outside. I mean, you're encouraging pneumonia, I guess, over a virus. You know, I guess that's the logic now. So, hey, as long as we prevent this virus, there's no chance of you getting pneumonia now. There's all these other issues that we're going to have to deal with. And then we have a governor who's basically making up these rules by himself. But he's saying, hey, travel advisor, you shouldn't be traveling. But he's going to Maui himself, and he's going to be visiting with other legislators from 4 different states. But he's saying, well, if it's essential, then this virus, I guess, goes away. If it's essential, you're not at risk of getting this virus. But if it's not essential, as I deem it non-essential, then there's a risk. Then you're probably going to spread this thing. It's just, there's just no logic to this. So I'll leave it at that, and I do have, I think, a different way of addressing this, but I'll let you respond to my statements. I know it was a lot, Dr. G. Thank you.
Thank you, Supervisor Hernandez. Doctor, you have anything to comment on Supervisor Hernandez's comments?
Is he still on?
Looks like he's on, but maybe he's having connectivity issues.
Do you have anything to comment on it, Tracy, by any chance?
I was going to see if Lynn wanted to comment. She's available here as well. Lynn, did you want to comment on any of Peter's comments?
Good morning. Yes. Well, I can just say that one of the issues is that for every one known case, there are probably 3. I mean, the data is telling us that there are probably 2 to 3 unknown cases. And so there are people out there walking around not knowing that they are infected and infectious. Masks are a tool, but, you know, again, people's behavior, you know, is, you know, they act in their normal and natural ways, you know, unconsciously. And really, it doesn't come easy to folks to do 6-foot distancing and to, you know, pull their masks down and talk over their masks. This is unfortunate, and I know that I've been on some calls where, you know, state officials have really discussed the issue that, you know, there is a rise in community transmission, and in other counties, they are seeing some cases coming from restaurants. However, you know, they are having to make these very difficult decisions, and I am hearing, you know, officials saying, you know, why are we doing this, you know, to the business community, you know, when we're really not seeing a whole lot of numbers coming specifically out of businesses. So it's very difficult for people to report and know that they got it from a business. That's another sort of unknown. I don't know, what else? Do any of, Anita, do you have anything you want to add in terms of what people are reporting?
No, I think.
Yeah. It is a very unfortunate and difficult situation that we have to deal with. And these decisions don't come easy to the state officials. They're trying to make these decisions based on data. I don't know what else to say.
Okay, I appreciate that, Ms. Mello. And it is hard, and you know, it's, you know, I kind of would like to see state officials be going in a different direction personally, but especially after people have made a tremendous investment, and even the government has made a tremendous investment in the business community as well. And if that's not necessarily the source, then we ought to be dealing with the source. But at this time, I think I'm going to open it up for the public comment. Is there anybody in the gallery that would like to comment first on this item?
Richard Betancourt, 4140 Southside Road. I've got up here before and stated that I believe that you and the state's responsibility is to make sure that you have enough respirators, hospital beds, and my thing is to put everybody back to work with guidelines. Understand, with guidelines. And then, as Anthony said, a lot of businesses were responding to the guidelines by putting up shields at their businesses at a great cost. In my business, several years ago, we had listeria, which cost businesses millions of dollars with the guidelines so that they don't want anybody to get sick. Neither does Peters doesn't want his constituents or his people that go into his business to get sick. So go by the guidelines and put everybody back to work is my comment. Thank you.
Thank you. We'll go Supervisor-elect Tiffany.
Good morning, Bob Tiffany, longtime resident, Supervisor-elect, District 4. You know, as was already said, this is an extremely difficult time, obviously, we're all dealing with. There are no good answers, but I would just say that it's obvious that there's been tremendous spikes throughout the state, in our own county, throughout the country, and I think that we have to take what's happening extremely seriously. And you know, from what you hear from the scientists, this is going to get really ugly before things get better. So I understand the frustration, certainly from the business community. I come from a business background, but I also think that we have to be extremely careful. And I think the problem is, even though maybe most of the recent problems have been from social gatherings. When you're looking at interior dining, for example, obviously you have to take off your mask in order to eat. And even though there's shielding and social distancing, it's been shown that the virus can be transmitted within an interior space, and I think that's probably where the concern is. The only other comment I would make is that we talk about people having being responsible, and unfortunately, in our county as well as throughout the state and the country, we see this. There are individuals that are not responsible. You know, I see just in the last day or so on some certain Facebook pages, people talking about having mass burning parties, that kind of a thing, and that's, you know, totally irresponsible. And it's, you know, that kind of behavior and those kind of those people that are making things much worse and are going to only extend the problem. So those would be only my comments. You guys have a really difficult decision on all these issues. In a couple months, I'll be up there as well. I realize it's a really difficult
I bet you're
time,
looking
so-
forward to that.
Yes, I am. Very much. Okay.
Okay.
That's it. Thank you.
Thank you. Supervisor-elect Kosmicki.
I promise I planned to talk before Supervisor-elect Tiffany got up there, not just doing it for show. First off, I want to just commend the board on your handling of this crisis, and particularly the way the county and the staff has allocated the dollars. I think it's been an outstanding job where those dollars have gone. We saw with the parklets this past Saturday, a really great investment in our community. So thank you for that. And also to public health, I think our public health department has really shown that it's really first class and done an exemplary job of dealing with the challenges that are confronted with us here. And I certainly sympathize with Supervisor Hernandez. It's really frustrating. It has to be really, really frustrating for a local business owner to be yanked back and forth like this, and it's just going to get tougher and tougher for these businesses to stay open as time goes on. So I really echo your frustration with the state on that. That being said, I think we really do have to look at locally all the tools in the toolbox, so to speak, and I would say we need to really seriously, even though the state has a face cover mandate in place, it's guidance, it's not really clear. There's really no enforcement involved. We really have to relook at a county bringing back discussion about a face cover mandate to bring us in line with the city of Hollister and the city of San Juan Bautista to have consistency, and mostly to send a message to the public, not to penalize people per se, but to make sure that people understand the seriousness so that we can get back to going into these businesses sooner than later. And I also would just say outreach, and I think it goes hand in hand with outreach. When you have a mandate, it really sends that serious message to the public, and I would just suggest that we really look at other ways going forward, that we really underscore outreach and how we can get the message out to the public that we really have to follow these rules locally, or else who knows when we're going to get back to a normalcy here. So thank you.
No, thank you very much. Very good points by both Supervisor-elects. We'll go online.
Valerie, please state your full name for the record. You will have 3 minutes.
Yes, this is Valerie Eglin, San Juan Bautista. I would agree with the direction that has been given, and also sympathize with Peter Hernandez about the difficulty of personal rights, coverage, and enforcement. It's a very, very difficult situation we're in right now, but obviously the science tells us that it's going to multiply beyond our imagination if we do not do something. If you look at exponential growth from this point through the holidays, people are going to die needlessly. If you're going to die, you're going to die. But if it's needless because we are not prepared, cannot possibly be repaired or prepared, then we need to mask up. So those are my thoughts. Thank you very much.
Thank you.
Courtney, please state your full name for the record. You will have 3 minutes.
My name is Courtney Evans. Wow. So I first want to bring attention to an item agenda that you spoke about about an hour ago, where you guys requested that there was a group be present for the information. First and foremost, this conversation has gone on for 9 months, and never have there been a welcomed non-stakeholder or citizens available. You don't allow people to come to these meetings and see who you're putting in charge to put these mandates and these threats to these businesses. And then we're still continuing. Let's talk about behavior. The doctor talked about behavior. Lynn Mello talked about behavior. Bob Tiffany talked about behavior. What about our behavior of our eating habits? If we're smoking, do we exercise? You talk about it like the immune system has no relevance in your health. None. That if you put on your mask, everything is okay. It was given a little bit of speculation that, like, when this vaccine comes, that everything is fine. To completely mandate, control, and manipulate the people it's absurd. Now, since there's some uptick in positive cases, we've changed the rules. There was a business owner that took 4 tests in a day. He got 2 positive, 2 negative back. Now all of a sudden we're talking about hospital beds, but a month ago that didn't matter. We are making a healthy person look like a criminal. And you have 0 other opinions on our calls at all. This is absurd. I ask that the American people, the people of San Benito County, do not comply. Do not close your businesses. As always, let your health, let your body be your #1 priority every single day. Take care of yourself. Be responsible for your health. If you're sick, stay home. If we work together as a community to stand up for our human health, our rights as Americans, stop this. It starts with us. All we're doing is regurgitating over and over again what happens. And once again, I'm going to request a member of Open SBC be present for all of these meetings. We're still waiting on the emails from the health department, from the health director, regarding all of this the last 9 months. It needs to stop. And it starts with us, the people. Stop complying. Take care of yourself. I'm ashamed in the conversations, and even our elected or our suspected elected officials that are in there saying it's going to get worse. I feel sorry for the business owners. Don't feel sorry for us. It's time for us to stand up together.
Thank you very much. Anyone else on Zoom?
We have no more speakers on Zoom.
Anyone else in the gallery?
Elia Salinas, I have for months and months stated that this virus is based not in our county. It's not based out of California. This is a worldwide epidemic based on the science and the facts and the data. Decisions have been made. This became politicized. We were asked for a few weeks in early spring to follow some simple rules to literally help humankind to survive. And there are people out there, and I respect their decisions, and they're allowed to voice their opinion just like I am. But to realize, or they do not realize, and we have a supervisor who happens to be wearing a facial mask that has no filter. It doesn't work, it's just there for view. Wear a mask, wash your hands. The reason the businesses are being affected is because of the behavior of people not willing to have followed rules, and the numbers are increasing. They're increasing because people think that they're immune, and they gather together with other friends and other family members, and it is spread. Draw a circle around yourself. Then draw a circle around the people that you hang out with. Draw a circle of the people that hang out with those people. And eventually, someone in your circle that comes into your personal circle has come into contact with someone who has this virus. This is a virus that could potentially kill you. We already know that it's killed hundreds of thousands of people across the world. This is not a problem in San Benito County. The problem in San Benito County, our numbers are increasing because people are not following the rules. If we could just follow rules for a short period of time, we wouldn't be where we are today. We were warned that this could happen, and it's happened. And thank you, Colin, for bringing up the requirement of wearing a mask, and I think that the county should go ahead and come back with something like that. There's an economic impact. The hospital capacity was the priority why people were asked to withhold from being out there without doing and become essential. Thank you.
Thank you, Ms. Salinas. Looks like we have one more.
More Tiff, if you can please state your full name for the record, you will have 3 minutes.
Hi, good morning. It's Tiffany Moore. I just wanted to keep it short and sweet. I think it's important to keep our minds solution orientated. The way to rally behind these businesses and come together as a community is to support one another, wear our masks, listen to doctors. It's logical. Mr. Hernandez, you don't see the logic. Doctors are literally giving you data. It's logical. And to say that people that are traveling and if you're essential, then you're immune, that's just absolutely a ridiculous statement. And the people that are being punished, I think we just need to have a different frame of mind about this. And I don't think there's any more of a punishment than families that have lost loved ones. That's the ultimate punishment. It does come down to individual behavior, and setting an example and speaking at a rally with no mask was probably not the best example, and that is individual behavior, individual choice. But I do think that it's been month after month after month. Let's change our way of thinking. Healthy people get COVID. I've seen it. It's happened to my family. People that have faith over fear get COVID. It's happened to my family. And so we just need to come together so we can get out of this. Stop arguing, evolve to a different mindset, because what we're doing and how we're speaking, it's not working. And I just want to thank Ms. Salinas, Supervisor-elect Tiffany, and Mr. Tiffany and Kosmicki. It gives me hope. It really does. And I appreciate all of you. I really do. And Mr. Hernandez, I sympathize with your frustration as well. I just think that we all can be better than this. And please, listen to one another. Stop playing the blame game. Not everything is the governor's fault. Thank you.
Thank you. Looks like we have one more.
Zoom user, please state your full name for the record. You will have 3 minutes.
My name is Suzanne Garcia. First of all, I don't see anywhere in state, like in our Constitution and public health policy, where does it state that you guys are to promise the citizens immunity or immortality? That's like non-existent. So the fact that you guys think that you can eradicate a virus with a mask, with hand sanitizer and social distancing is completely absurd. Secondly, I have not heard anybody talk about the fact that our governor has been sanctioned or legally that he was taken to court and the whole state of emergency was deemed, it was unconstitutional. So you guys are not taking the law into consideration with these policies. You think that masking and hand sanitizer and social distancing is going to eradicate this virus. You have not talked about vitamin D. You want people to shelter in place when the sun is clearly the natural source of vitamin D. Vitamin C, all of those other natural things that we can do, exercising, all of those things boost our immune system. However, you guys completely, public health officials, I have not heard anything about how we can improve our immune system. All you guys talk about that. You fail to ignore that the PCR test has over between 80 and 90% false positives. And that's what this whole pandemic is based upon, is the cases. If you refer to Barr's law, what does it say? Death is factual. Anything else is inference. You're not basing on death. You no longer take the flu into account. The flu is basically gone. There's no testing. There's no death mortality rates of the flu. So where's the flu? Where's the measles? Where did they go? Everything's COVID. And now you guys are COVID public health officers. You don't care about suicide. You don't care about depression. You don't care about child abuse. It's all COVID. That's not what public health is about. It's about everything. And that's all you guys think about. And you think that by masking up and using hand sanitizer, that's going to eradicate the virus. No, the virus isn't going to go nowhere until we reach herd immunity. And look at the death rate. The death rate is practically, it's declined. It's not increasing. The cases are increasing. Why? Because everybody's testing, and the testing is flawed. And that's what you're basing it.
Thank you very much for the comments.
Hunter, please state your full name for the record. You will have 3 minutes.
Hunter Cuneo, resident of San Benito County. At this point, I'm disappointed. I'm even disappointed in those who are disappointed that some people, for example, would be surprised that our governor doesn't follow his own guidelines when he was caught going to a party the other day. I mean, that's the whole thing. It's like, duh. That's how tyranny works. The 1% or those in charge, they don't follow their own rules. That's what is going on here. And to those saying, follow the logic, follow the science, I really encourage one of you, please, to ask our health department, who you have there with you, to explain the logic and science behind the guideline that says if we are to visit family on Thanksgiving, we can only stay for 2 hours. I'd like to hear the logic and science as to why after 2 hours, maybe 2 hours, 5 minutes, why we are at more risk of being infected at that time than we would be at, say, an hour and 45 minutes. So I want to hear the logic on that. And, it's disappointing because you guys won't stand up to this governor. And I'm sorry to say, but it's kind of like little kids. I mean, like believing in the tooth fairy. To really think that this guy and all these leaders, they're doing this because they love and care about us so much. And it has nothing to do with control and power. I mean, it's like thinking like a little kid who doesn't understand history, doesn't understand that when the government takes your rights, rarely in history does it just give them back to you without any resistance. So I'm disappointed in our community. I mean, that because ultimately it lies with them, that people won't stand up to this, that they just comply and comply. And again, you got 90% at worst case, 90% compliance on the mask, probably 95%. Anything that has that much compliance and they're still getting a spike in cases, that is proof, that is scientific, that does not work. It's not those 1% of people walking around without a mask that's spreading this disease all around. The masks don't work. We have the proof now. There's no correlation between stricter guidelines or mask mandates and a decrease in this virus anywhere in the world or around this country. You can look at the graphs. They're online. there's no correlation between lockdowns, strict mandates, and a decrease in these cases. So just, again, just disappointed. Nothing else to say, really. Thank you.
Thank you. Anyone else? If not, I'm going to close the public comment and bring it back to the board. This is just a presentation today. There's no action involved in this, but any other final comments from the board
Yeah,
members?
I do have something to
Yeah,
say.
Mr. Chair, we did also have Deputy County Counsel Irma Valencia on the line,
Oh,
if you wanted to hear
let her
about the
talk first.
Gallagher case.
Let her talk first. Let her talk first.
Okay.
About
If the
what?
chair, if the clerk could unmute Irma Valencia?
If she has anything.
Okay.
That was the second part, just to kind of give an update on the recent legal action
I see.
on the Gallagher case.
Okay.
It's a state of emergency, right? The one that the lady spoke of? Yes. Well, let's clarify what the lady said, that it was illegal.
Can you hear me?
Yes.
Okay. Hi, I'm just here to provide just a brief update on the Gallagher versus Newsom, also known as the Sutter County case that came out a few weeks ago. The case was filed in state court in Sutter County Superior Court by Assemblyman James Gallagher and Kevin Kiley. They were challenging a specific executive order, N67-20, that was issued by the governor relating to election procedures for the November general election. The substance of the complaint was that the governor's use of executive orders to amend, alter, or change existing statutes was an exercise of legislative power and in violation of the California Constitution separation of powers. The governor's position was that the California Emergency Services Act granted him the authority to exercise all police power vested in the state and allowed him to make laws, issue and enforce those orders and regulations as he deemed necessary, and authorized him to legislate by unilaterally amending existing statutory law. The Superior Court judge in Sutter County ruled against the governor on November 2nd and issued a tentative ruling, which became final this past Friday, November 13th. Her ruling upheld the constitutionality of the California Emergency Services Act. She said that that act did not delegate to the governor the power to legislate, so it was not unconstitutional. Assemblyman Gallagher and Kiley were put forth an argument that if the court were to find that what the governor did was okay by issuing executive orders that amended state law, then they were requesting her to find that the Emergency Services Act itself was unconstitutional. The judge did not do that. The judge found that the Emergency Services Act was constitutional. However, she did also rule that the action that the governor took by issuing that executive order was unlawful because she reasoned that the act basically amended or changed certain election laws. And she said that the Emergency Services Act, if you read the plain meaning of the language, did not authorize that. And therefore, he violated the separation of powers. The court stated that the Emergency Services Act allows the governor during a state of emergency to issue orders and regulations and to suspend certain statutes, but that the plain and unambiguous language of the act does not permit the governor to amend statutes or make new statutes. That right is reserved for the state legislators to do. She also granted the plaintiff's request for declaratory relief, which is basically stating what the law is with regard to the executive order, and she deemed it void and an unconstitutional exercise of legislative power and no longer enforce or in effect. And that was specific as to Executive Order N6720. She also granted the plaintiff's requested injunctive relief and issued a permanent injunction preventing the governor in his official capacity and prohibiting him from exercising any power under the California Emergency Services Act, which amends, alters, or changes existing statutory law or makes new statutory law or legislative policy. Now, as of yesterday, the state filed a writ of mandate at the 3rd District Court of Appeal and an application for an immediate stay of the order. I'm not, as of this afternoon or right now, there's no further indication as to what action the appellate court is going to take. Now, the ruling does not affect the public health orders that have been issued by the state at the state level. Those orders are issued not under the California Emergency Services Act, but they're issued under a separate health and safety code, which grants the authority to the state public health officer to combat contagious, infectious, and communicable diseases. So we'll need to stay tuned as to what the appellate court does. They can uphold the lower court ruling, or they can overrule it, or somehow send it back to the lower court for further hearing.
Okay, all right, thank you, Ms. Valencia. You have anything further to add, Ms. Thompson? Nothing?
We'll keep you up to date as things evolve.
All right, very good. Any questions from the board or comments?
Comments, definitely, Mr. Chair, if I may.
Yes.
Yeah, I appreciate Ms. Valencia's framework that she shared. I feel like it should be iterated. It's strongly that in that opinion, the judge also clarified when it comes to the injunctive relief why it's going to be necessary, because I guess after January, early 2021, the date as of the date is repealed, there would be a need for a special election to basically amend his emergency powers. Right now, I mean, her basic statement is the evidence persuades the court it is reasonably probable the governor will continue issuing executive orders which amend statutory law. And for those that need clarification, and I've had long discussions with county council about this, statutory law is according to the legislature. They write law. They have the authority to. He doesn't. He changed the law. Under the Emergency Powers Act, he basically took it upon himself to change things that he had no authority to change. He did have the authority to suspend certain statutes, specifically with disease mitigation or addressing this virus. But it doesn't mean that he has, it's for temporary purposes. But he does have authority to issue, to basically any regulations or orders, right, under maybe departments, some kind of executive orders that actually implement the law. But so to point out that he has the authority to implement, but not to change law. And that was her main statement. But for her to say that he's going to continue issuing executive orders, by default, creates a lot of instability. And this is one thing that I need to iterate to the new elect supervisors. We're talking about stability in our community. You're not going to get it by forcing people to comply. It's just not going to happen. It's all across the country. You don't have to believe me. There's people that are standing up and they're pushing back. That's not what a union is. That's the opposite of a union. That's like me walking into your house and telling you what to do with your home, with your rights. It's not a simple solution to say, oh, let's just put out a mask order and force people to do this, but we're going to try to educate you on it. They're still not, the perception now has become so animus, you're not going to get the response. It's like trying to sell something that's not sellable. No one's going to buy a mask order, or I should say in general, the people that don't want this aren't going to take it. And by default, that's going to create more division and divide our community more. So I would encourage you, all of us and the new supervisors, to consider that once we come up here on this dais, we have to work together and figure out how to unite our community. This is not the way to unite it. But back to the point of the governor, for her to say that, she clarified, she said violating, which, the evidence persuades the court is reasonably probable the governor will continue issuing executive orders which amend statutory law and create legislative policy under the purported authority of the CESA, which is the California Emergency Services Act, violating the California Constitution and the rights of plaintiffs thereunder, and giving rise to a multiplicity of judicial proceedings unless restrained, those are her words, not mine, unless restrained by an permanent injunction. She's actually advising that he needs to be restrained.
No, she's not.
Those are her words, Supervisor Medina.
It's how you read it, Peter.
So what, restrained means something different? Tell me where in the dictionary it actually iterates two different definitions.
Peter, Mr. Attorney.
Yeah, so
Let's keep
just-
Supervisor Hernandez on the floor and
Attorney.
refrain our comments when we have our
you
opportunity.
take offense to it. I apologize, Supervisor Medina, but I don't apologize for my statements because the reality is this is what's happening, whether we like it or not.
Oh, sure.
So at the end of the day, if we're gonna keep doing this, how about we start to make resolutions where we say for every time that we violate the Constitution, taking away people's rights and taking away their even ability to take care of themselves, how about we start reimbursing them for every day we shut them down? How about we start coming up with some solutions and say, okay, fine, we believe this is for the common good, for those that are living and making their money and they're okay and they're fine, and those that aren't and they're going away, how about we come up with some declaratory relief for them? Because that's not what we're talking about. We're saying this is so good that if your business goes away, hey, that's for the common good. If your livelihood goes away, hey, it's for the common good. If you lose your medical insurance, hey, it's for the common good. Tell me where there's logic in that. Tell me how you can make that statement coherent to the public. It's not gonna happen. So, and you don't have to believe me, but like I said, the animus is growing, and I have a resolution that 14 counties are looking to adopt, Northern California counties in the Yuba area. Assemblyman Kiley and Gallagher actually they're formalizing with the Senator Brian Dahlia, I believe, who's actually looking to advocate for it. And it's called the Healthy Communities Resolution. So it says, whereas the paramount concern of policymakers at all levels in the health and well-being of our constituents, never more so than during what has been called the once-in-a-century pandemic. Whereas decisions affecting the health and well-being of our constituents must be based on empirical evidence without regard to politics or the influence of special interest groups. Whereas
Please, Ms. Lewis.
California has struggled as much as any state during the COVID-19 pandemic with the third highest unemployment rate in the country, the largest backlog of unpaid jobless claims, and the fifth worst excess death rate west of the Mississippi. Whereas California's blueprint for a safer economy provides a one-size-fits-all approach to reopening communities that fails to allow the flexibility to respond in a data-driven way to what is occurring in our county. Whereas the blueprint largely impacts the operation of businesses and schools without any showing that those environments are responsible for COVID-19 cases observed in our county. Whereas our county has seen increases in drug abuse, delayed medical care, depression among our youth, and the overall needs for mental health services. Whereas our county is extremely concerned about the impacts for our children of any further delays to in-person education. Now, therefore, be it resolved by the Board of Supervisors that these facts demonstrate a need for collective and unified actions from our county and surrounding communities, and it be further resolved that Yuba County, or the county that applies for this, approve the resolution with commitment to the following principles: that our county is best served by an ability to respond locally, which is exactly what I've advocated for, to the COVID-19 virus in accordance with our local data and circumstances as specified, for instance, in the attestation filed with the California Department of Public Health, that our county is geographically diverse and ill-suited for the county-wide restrictions imposed by the blueprint, and the state should enable our COVID-19 response to be tailored to geographically separate areas such as different zip codes as circumstances and cases levels warrant. That school districts in our jurisdictions are urged to safely open all schools as soon as possible and provide in-person instruction to the greatest extent possible without further delay. That our county requests an extension of time beyond December 31st, 2020 to encumber and spend our federal CARES funds to which we are entitled by law, consistent with our respective local plans and programs.
Well, what I would suggest, this is just a presentation today, Supervisor Hernandez. Maybe you could work with staff to, bring that to the board, to the next meeting or something if we need to take an action, but we can't take an action on.
And
on
that's,
something
yeah,
like that.
I
But
just,
So just in the case of, moving the.
I was
meeting
just sharing it, Supervisor, I agree. And I do hope we become unified on this, and
Yeah.
the answer is not listening to the state. It's doing what we have to do to address this locally.
But,
Supervisor Benito?
Peter, you talk about not listening to the state, doing it locally. You don't listen to locally either. The public health officer says something, and you discount it. You say it's wrong because he's getting his marching orders from the governor, which, like I told you before, I'm not, and I don't want to talk about this right now, but since you brought it up, you look at this, if it was centralized, if it was in one geographical area, I would agree with you 100%, but this is not. I just received a text from a friend in Italy. They're on lockdown right now in Italy. So
Response is different than the
Please,
virus.
Supervisor Hernandez, I
different
kind of
things.
gave.
So when you look at that, I'm not saying a lockdown. I did not say that. I'm just saying it's everywhere. It's not just in San Benito County. It's not just in the state of California. It's in the United States, and it's in different countries. And once again, I would react different if it was just in a centralized area. I have friends that are no longer friends anymore because of this COVID-19 issue. I have business owners that I know are failing because of this. I look at it the same way that you look at this, and I talk to Tracy probably a couple times a week asking about tracing, because when I look at that, it's okay, did it really evolve at a grocery store or at a local taqueria or a McDonald's? And it always seems to appear to me that it happens in a family setting or some type of a social gathering like that. So do I agree with everything just being shutting down? No. But, we have to do something. We can't just ignore it and pray to God that it goes away, because I've tried that. It didn't work. So I don't know where I'm at right now. I was disturbed on Monday, and I know Ray can attest to that, with the outcome of the governor's decision. I'm also, look at the governor, and, as a leader, he is not leading by example. When he did go to that restaurant. I mean, it's not acceptable. And I'm not saying it is acceptable for him. It's not acceptable for anyone to do that. That's why I am very conscious of when I leave my house, where I'm going, what I'm doing. Because once again, we are on parade. We are being watched. And we are the leaders of this community. And we need, during the tough times, that's when you have to really put on your boots and then go to work. And some decisions we make, half of the people aren't going to like, and the other half are. And I'm just looking at things differently. I don't look at it through a Republican tunnel or a Democrat tunnel. I'm a declined state, so I'm a little bit different because I look at it on both sides. And that's how I make my decisions. And I do. I read the entire case several times from the attorney. And I've talked to Barbara for several hours on it, and I've talked to other people in Sacramento about it. And once again, it's just sometimes when you're tunnel visioned in one certain area, you often just levitate to the right or levitate to the left. And I'll just repeat again, I'm a little bit different because I'm straight down the middle. And I just wish all this would go away like everyone else. I wish all the businesses were open. I wish we can go back to normal. We have problems with, I think it was Mr. Cunha said it perfectly, is throughout our conversations, it's about health. I mean, it's being able to eat right, being able to go for walks, being able to, do you smoke, do you drink? There's a lot of different things people can do by just wearing a mask or not being around people. So those are some unanswered questions. If I had all the answers, I'd be a very successful person. But I don't have these answers, and I'm trying to navigate through this just like everyone else. So thank you.
Okay, all right, thank you. I think I would advise perhaps to look at that resolution, work with staff and get it on a agenda for discussion and possible type of adoption. But today, this is a presentation.
Yeah.
I think we beat this pretty well for last 45 minutes or better. We probably should move on with our
Really
agenda.
quick, Mr. Chair, I just want to clarify, because I'm trying to understand Supervisor Medina's sentiment. I never opposed public health. I never said you shouldn't encourage guidelines. I mean, this actually says it's still, the whole idea is it's still addressing the virus, but it's addressing at a local level. But my point is these cookie cutter rules are doing nothing good for our community. And at the end of the day, if we're talking about addressing this, then how about we involve the actual people that we're hurting in this conversation? We never once have we said, hey, let's see what you think, business community, and how could we make this better? I mean, I know when that happened through the salons, all of a sudden there was a change. All of a sudden they allowed salons to open, and the salons opened in a way that ultimately I think suited the interest of the business, and just the same protected public health, you know, but that's not what we're talking about here.
Okay.
At the end of the day, there is no relief. What we're agreeing, or what to a certain extent, if we do agree with the governor's rules, we do agree that there needs to be collateral damage to this, including the businesses, because we're not going to have an answer for them, and we're going to keep them shut down. By default, that means we're going to go ahead and allow them to go away.
Okay.
And I just can't be okay with that.
All right, thank you. We'll move on to item 19. We'll do one more, and then we'll go on a break. So,
Okay, well, this one's a housekeeping item, and it's regarding the Blackjacks and Kelly's agreement. And basically, as far as the Vets Park, what we had, some of the contracts for Vets Park we administer through the county, but we also have a lease with the city so that they administer one of the fields, and they did a sublease to the Hollister Blackjacks, which was subject to the approval of the county and the Veterans Park Commission. It took some time to get that approved by the Vets Park Commission because there was extensive discussions on the appropriate indemnification agreement. After the indemnification issue was finalized and resolved and we got a signed indemnification agreement back, then there was issues regarding the use of the field, and that also involved extensive negotiations regarding sharing of the field greater, so that there was an addendum to the agreement that was designated certain days that could be used by the city and certain days that would be used by the Blackjacks, but it was the agreement was amended through that addendum. But the addendum is also subject to the approval of the county. And so the action today is to approve the sublease, that was, approve the indemnification agreement and approve the addendum. And then it's going to be going to the board, the city council for approval as well at one of their future meetings. And that kind of clarifies and puts a lid on the past actions regarding the Blackjacks. There was some recent discussions at the Vets Park Commission. There was 2 meetings of the Vets Park Commission that arose out of a friendly games that was held at the park. The Vets Park Commission did send a letter, and they did receive a response, 2 responses actually from the Blackjacks. As a result of that, most of the major issues were resolved. It was affirmed in the letter that was received yesterday that no future games would be held until the COVID guidance allows that to occur. The one remaining issue is that there hasn't been proof that's been of insurance that's been presented to the city that's acceptable to the city risk manager. And so at the meeting yesterday, the Vets Park Commission made a motion, I'm going to paraphrase here, that it supports full insurance being provided pursuant to the contract, and that it, and I am paraphrasing, that it submits to the city council to take appropriate action pursuant to the contract.
correct.
And so the city may take action. There's 3 actions that it could take, potentially. It could terminate the agreement, it could purchase insurance and bill that insurance to the Blackjacks, or it could they also, and I believe that this is what they're gonna do, is they may prohibit the blackjacks from using the field until the proof of insurance is presented. So, we're just trying to kind of capture this all, put it to bed, and then the next time that, hopefully, that the board will hear this agreement is that the 5-year lease is up in 2022. And then we'll have to decide, the city will have to discuss that at a future point in time.
Okay, very good. Any comments?
Yeah.
Supervisor Medina?
I sit on the committee, and I was at the meeting last night, and, what we're looking at here is, what I'd like to see is to approve the contract, and then hopefully the city will not allow any activities to take place until we're fully covered with the insurance. That's kind of the direction we gave, if that,
Well, I think that we deferred it to the city because it's their contract, and we think it's appropriate for them to decide what to do to make sure that they're protected as far as the insurance and
Yes.
what they want to do. So I just defer it to them on that issue.
Yeah, well, I would think that our contract would require the city to make sure that if they're induced any sort of subleasing, they would have that subleasee cover with insurance
Yeah.
anyway, so it kind of.
Yeah, they should have the insurance.
Okay, any other questions from the board? Any questions, comments from the public?
I would just like to confirm whether there's a phrase, or can there be added a phrase in the lease, that if they were to violate again and gather during COVID, that the lease would be void and invalid. Also, for them, there is a contract, and since they're not able to, or a lease, since they're not able to use it, I want to confirm that they're not required to make payments while they're not being able to use it. I mean, is there a payment involved in this, or just an exchange lease? It's just
They do maintenance of the field.
Pardon me?
They do maintenance of the field.
That's the payment?
yeah.
Yeah.
Okay.
Yes.
All right. Thank you.
And just for your clarification, there is a clause in there about the COVID-19. They have a statement written in there.
Okay, thank you. Anyone else from the public? Go ahead.
Oh, there she is.
It's online.
Valerie, please state your full name for the record. You have 3 minutes.
Yes, thank you. This is Valerie Egland with Reach San Benito Parks Foundation. I took issue with, or I take issue with the Vets Park use and accommodation. It is a neglected group of fields. It is privatized to a point where these groups do not take any responsibility for the broader upkeep of the park. The Blackjacks are traveling teams that incorporate only a certain number of local folks. And I'm feeling that it's too restrictive for our population. You're right in the middle of Hollister City. And I think that when this lease is up in 22, that it needs to be severely criticized and reworked for the benefit of the whole county population. The condition of the areas around those fields is appalling. The little skate park is atrocious. The bathrooms need upgrade. Everything there needs help. And so for us to give away space without getting a good amount back to help the rest of the public is not acceptable. Thank you very much.
Okay, thank you. Anyone else from the public? If not, I'll bring it back to the board. Supervisor Medina.
I'd like to answer some of those questions. It is a traveling team, but they're required to have 65% of their people have to be in the county, in San Benito County. So that resolves that. Looking at all the skate park and the surrounding areas, you are correct. There is some upkeep that needs to be done. But this is why I support the Blackjacks and their group, is because that field that they take care of, it's impeccable. They've done a lot of upkeep. They've turned that around. They keep it up. And that's why I believe privatizing or allowing them to use it for a short period of time is, for me, the right thing to do.
Okay, all right, thank you Supervisor Medina. Any other comments from the supervisors? If not, I'll entertain a motion.
I'll make a motion to approve the sublease agreement between the City of Hollister and the Hollister Blackjacks Corporation. And the remainder of the staff recommendation.
Second.
Have a motion and a second. All those in favor say aye.
Aye.
Oppose? Hearing none. We'll take a short 5-minute break, stretch our legs a little bit. Thanks. Okay. We're back in session after a short break, and we're moving on to item 21. County Administrator Espinosa.
Thank you, Mr. Chair. Yeah, this item was brought to your board in September of this year to discuss the public defender contracts, and we did move forward with extending the contracts for 4 months until the new year, with the possibility of moving forward with an RFP. And with that, we are bringing this item back to move forward with an RFP due to the need that we really need to move this forward. So we're requesting your board, per staff recommendation, to go ahead and move forward with the issuance of an RFP. And with that, actually have the responses for December the 18th is the request from staff. And also then to move forward with, I think it's important to delegate the authority to myself, the CAO, to allow allow one or more public defender contracts for up to an additional 2 months, just to ensure that we have some flexibility when we're addressing and reviewing the RFP. We want to make sure that we still have that available for the courts, and to make sure that we have that available for the people. So with that, Mr. Chair, we'd like to go ahead and.
Okay, thank you. Any questions from the board? Supervisor Medina?
Yeah, I just want to be clear that it's a 2-month extension, and the RFP will go out, will be completed within a time frame, and 2 months from now, when the entire board's sitting up here, we're going to make a decision, and we're not going to say, oh, let's do another 2 months.
That's right. That's correct.
I
That's
got
the
your
plan.
word on
That's,
that?
well, yes, you have my word on that.
Thank you.
Supervisor Hernandez, you have any comments?
Yeah, 2 months from January.
Yes, no, exactly.
Okay, if not, then I'll open it up for public comment. Anyone from the gallery here?
So I want to thank the board for having not extended the contracts for an additional year and being able to make a decision. And the decision was for a new board to be able to come up and make a decision on how to proceed. I asked that we look for other local attorneys that may be interested. This contract has been going on for 10 years. And unfortunately, in those 10 years, there's been no diligence to confirm whether or not these 3 public defenders have done a good job or have done a bad job. I've worked for law firms for more than 30 years. People make complaints about attorneys and or partners. And I'm talking about people, I'm talking about the clients of those law firms. And those complaints go unanswered. I have been reached by numerous people that they made complaints to these law firms and they went nowhere. Well, they don't go anywhere, because if you're making a complaint against Joe Smith and Joe Smith is the only one in that law firm, he's not gonna do anything about himself. There's a survey that went out, and it was only done for, or to, those that are currently incarcerated receive the survey. We have 10 years of people having used these public defenders. We have to find a way to extend the time to be able to get that survey. I understand that it's been extended to December 1st, but we have 10 years of people. I did not find out about the survey until last night, and I blasted it out on social media. And I've been getting a lot of instant message, private messages about people who want to get together with me and find a way on how they can make these complaints. I'm okay. It needs to get done, a 2-month period, extending the contracts for 2 months. An RFP needs to get done, but it must be done without, a rumor came to me last night that there is already, I don't know how they get this information, that the county, and I don't believe it to be true, but I will put it out there because it's being said, that the county has already has a law firm in mind that they're going to assign these contracts for. I don't know how these rumors get started, but they do get started, and y'all need to know about it. We need to be as transparent as possible. And I strongly urge that at the end of these contracts, we will have new attorneys representing the public, and/or I would like to see if the public defender's office can be operated by the county itself. Thank you.
Okay, thank you. Any other, come on up, Mr. Cantu.
First of all, thank you for listening to me. I was on YouTube watching this. I said, wow, this is interesting.
Oh, good.
Normally these meetings are not so interesting. So, and I did hear through rumor that she was going to be saying these things that she just said. So I guess it was a Facebook rumor. But anyways, and the surveys, we discussed it amongst most of the defense bar of what best way, and in fact, I think I've discussed it with some of the staff, what best way to process information on how the public defenders and the conflicts attorneys are doing in representing.
Can you possibly just state your name and who you are and what you represent? Because some people might not know, sir.
I'm sorry. I'm Arthur Cantu, attorney. I've been practicing here in the Ross building since 1994, so it's about 25 years. I do part-time conflicts representation, beginning, my first case was with 300 proceedings, which are where the parents are accused of neglect or abuse, and the state steps in and makes the children a ward of the court and makes decisions about their custody and visitation and so forth. I also do juvenile representation where juveniles are accused of breaking the law, and of course adults. And in the adult world, I've done everything from first-degree murders to felony murders to gang cases, 3 strikes cases, sex cases of every shape and size. And so, going back to this rumor that that is now before you about this, the best way to process the information of how the defense attorneys are doing, it's an idea to send out a survey to the defendants, and the people inevitably that get it are in custody. These people that are in custody have a whole host of competing interests when responding. They may respond for different reasons. And imagine they're also in custody for crimes, and so their executive decision-making powers have been corrupted for one reason or another. I suggested an alternative survey of those that work with the public defenders and the conflicts attorneys, such as sending out a survey to the DA's office and their staff that work directly with the public defenders, and with probation that works directly with public defenders, and of course with like county counsel that works in the 300 proceedings with the public defenders. That would give you a professional response with people that are in the industry, that are well aware, including the judges, and they'll be able to give you a professional response. And furthermore, when you contact an attorney's client in custody, he may say, "I'm not going to answer any questions without my attorney being present." So it puts a stress on the person having to respond, or maybe I'm going to offend my attorney. Whereas you're not going to get that same kind of pressure when interviewing public officials within the DA's office. So I'm just going to say that. But I just want to also go back, and I'll leave this table.
Mr. Cantu, I'll give you 30 seconds more. Mr. Medina asked you to introduce yourself and what you did. So if you, this is public comment where we just do the 3 minutes, but go ahead for 30 seconds more.
30 seconds, yeah. I listened to the section of Supervisor Hernandez talking about constitutional rights and how they're being invaded. The Chief Justice of California has taken the speedy hearing rights of the preliminary hearing. When you're charged with a felony, you have a right to a speedy preliminary hearing. You did, to have it done within 10 days or 60 calendar days. Those dates were changed by fiat or by signature without a vote of the people. Mm-hmm. Now, since 8th grade, I've always understood you change laws by majority vote in the legislative branch, not the executive branch. So it's not just out here with the governor. The Chief Justice is also changing penal code sections to change the times to address the current pandemic. I just wanted to say that. And I was offended because I grew up thinking if it's a constitutional right or if it's a law, it can't be budged. But now it's just budged by signature because of a real pandemic. But I've never understood
Okay.
that. Thank you very much.
Okay, thank you very much. Thank you, Mr. Cantu. Anyone else from the public like to make a comment? If not, I'm going to close public comment and bring it back to the board. I just want to say that, 10 years ago, I was part of a board that worked on the public defender's contract, and we did go out to bid. We had an RFP, we had respondents from a number of firms, and we believed at that time we picked the best firm, and after a period of time, we found we needed conflict lawyers as well. And I believe Mr. Cantu has a contract for, whenever our primary public defender, he steps in and helps with our conflict cases. And it's a lot more complex than just assigning a contract to a law firm to provide public defense services. And so I think it's real reasonable to look at this again, extend this contract for another couple of months, and the new board could probably tackle it and have a subcommittee that will evaluate an RFP and try to get the best services that we can for our community.
Yes,
So
sir.
any other comments from my colleagues? Okay, if not, what action do we need right now?
First staff recommendation would be fine. I just wanted to note that this has been, we requested that this be posted at Behavioral Health, Health and Human Services, and Probation, as well as provided to the jail. And there has been no firm that's been selected. I assume that there'll be a committee that's formed to evaluate the responses that come in.
Make a motion per staff's recommendation.
With one
Second.
slight edit, Mr. Chair, if I may.
With one slight edit?
December, on staff recommendation, it says either December the 8th or the 15th. It's actually December the 18th, Friday,
We're extending the.
on the responses for the RFP.
And I have a second from Supervisor Hernandez. All those in favor say aye.
Aye.
Pose? Hearing none, we'll move on to agenda item 22 for the Samuel Housing Advisory Committee bylaws and rules of procedure. Mr. Young.
Thank you, Mr. Chairman, members of the board, Mr. Espinosa. With us this morning is Jamila Saka. She is the housing program coordinator for both San Benito County and the city of Hollister. And we have two items that you will be considering today. The first one just establishes bylaws for the Housing Advisory Committee, which is required by the affordable housing regulations of the county. And Jamila can expand on that just a little. And then there's a companion item 24, which is a public hearing on some changes to the actual ordinance of the county relating to affordable housing.
Mm-hmm.
Thank you for the introduction. And so again, related to the bylaws, it's something that was created as part of the Affordable Housing Ordinance. One amendment that we did make is to increase the number of members of the public who are a part of this Affordable Housing Committee. So one thing that we are amending is to have it increased from 2 to 3 members. So we'll have, or what we are seeking to have, is one member of the financial or accounting background, one member of the affordable housing development background, and one member of the building development background. So that is the biggest change that you will see. Are there any questions or any concerns?
Any questions from the board? No, Supervisor Hernandez. Okay, if not, I'll move it to public comment. Anybody from the public would like comment on the bylaws of the Housing Committee? No? Anyone online? All right, well, that's easy. I'll bring it back to the board.
No, just for the record, I sat on this committee, myself and Supervisor Dela Cruz. So, it was well vetted. We spent 7 months probably on working this through. So I will gladly make a motion to approve the San Benito County Housing Advisory Committee bylaws or rules of procedures.
Second.
Okay, we have a motion and a second, and that's to approve the bylaws and open up application and delegate authority to the clerk of the board to accept applications. Okay, all those in favor say aye.
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 Opposed? Hearing none. That takes care of that one. Okay, now we go to public hearings. Adopt a resolution approving solid waste collection rates for effective January 1st, 2020 through June 30th, 2021. Director Young?
Thank you, Mr. Chairman, members of the board, Mr. Espinosa. This is a public hearing with regard to the rates charged by Recology to both residents and businesses in the community. We have with us today, I hope, online, both the manager for the Integrated Waste Management Program of the county, Kathleen Gallagher, and also the general manager for Recology. His name is Phil Couchy. So if we would get them on board, then Kathleen will summarize the item that's in front of you and the history for it, and then you can have your public hearing.
Okay.
Thank you.
Any questions or comments
I
from
want to
the?
make sure. Good morning. I want to make sure you can hear me.
Yeah.
We can hear you.
Oh, great. Thanks. Good morning, Supervisor Botelho and Supervisors. The item, as Benny has just explained before you, is regarding the approval of our franchise hauler Recology's collection rates for the period of January 1st, 2021 through June 30th of 2021. So as you'll recall, the board heard this item on June 16th, and at that meeting, the rate increase was deferred due to the financial impacts of COVID on our residents and businesses. The board had directed staff and Recology to find an acceptable method to defer the rate increase due to the financial impacts on our residents and our businesses and the rate increase. So from July through September, our regional agency senior staff met several times with Recology's general manager and controller. Phil Couchet is on the line if you have any further questions or if the public has any questions, to consider alternatives and to for the increase. So as previously discussed, the regional agency members are contractually obligated to compensate Recology per the approved franchise agreement. And at the October 6th board meeting, the board did approve the 6-month rate deferral. So instead of having our rates increase July 1st of 2020, they would then increase January 1st of 2021. And we established that first amendment to the franchise agreement. We did that at the October 6th board meeting last month, and which allowed us to establish a balancing account. That was approved the October 9th meeting, and we had established the first amendment to the franchise agreement. This brings us today to the public hearing where the recommendation is for the approval of the Recology rate increase as detailed in the public hearing notice that was in your staff packet, as well as the staff report and the resolution. I'm happy to answer any questions, but I did want to bring some specifics to the rate increase and what it would actually mean to our residents. So this rate increase that is effective January 1st of 2021, the majority of our residents will see a $1.45 per month increase. For businesses, and I know every dollar matters right now, certainly with our COVID impacts, businesses with a 96-gallon container will see a $3.66 per month increase. I'm happy to go over the specifics of the resolution and the staff report, but I wanted to see if there was any questions and certainly allow Phil Couchet to speak from from Recology if the board or the members of the public have questions.
Okay. Is there any questions from the board for Kathleen? If not, then I'm going to go and open the public hearing. Anybody from the public would like to comment on this?
Thank you. I want to remind the board that this started back in April when I came forward and I was against the rate increase. I requested a stay, and we got a deferment. It sounds all great that it's not going to be on the residents, but the county is going to pay for it, and the county are the residents. So in the long run, we are paying for it. I want to remind Kathleen, you work for the county, and it is your duty to do the best that you can to negotiate for the residents of San Benito County. There's nothing that I can do about this because it's already been taken care of. It's already going to happen. But I remind you that next year you're going to come forward and you're going to ask for another rate increase. The rate increase that you get, you do not pass along to the employees. Recology, I'm talking to Peter now. Recology's employees don't get that. It's a multi-billion-dollar company. The lack of humanity, empathy from this multi-billion-dollar corporation is sickening. You had the opportunity to do the right thing, and you chose to do something that you think that people are not going to notice. But we're paying attention. And when you send out those Prop 218s next year, that's also going to be a challenge because the Prop 218 are only for property owners. This was not notice sent to the ratepayers, and there's got to be a way to let all the ratepayers know that they are the ones who should be able to make the choice whether or not they agree that there should be a rate increase. $1.45, that's great. It's almost $500,000 for San Benito County residents total, or probably more, because I only rounded off the numbers. $3 for businesses. When Recology was up here for trying to get the contract, I said Recology is known for raising the rate increase once they get the contract. It was actually Green Waste that had the best bid, but Recology, what they did is they lowered the prices for the residents and they increased it for the businesses. Now we are in an economic crisis where the businesses are being affected, and $3 makes a big difference for a company who's close to being closed down permanently. Thank you.
Thank you.
Members
This
of,
is Phil Couchet. Can you hear me?
Yes.
Okay, thank you. I just want to make a clarification. During the bidding process, there were 3 companies that bid the contract. All bid the same requirements, the same specifications. It was very thorough, and in fact, Recology was the lowest bid of all 3 proposers. And then, in addition, one more clarification. I know it's been said that Recology raises rates, more often than is allowed, and that's simply not the case. For the last 10 or 12 years, we have been adjusting rates on an annual basis as the contract allows. And no other time during that time period did we raise rates, outside the contract. And in fact, if those have been around for a little while, can recall there were years when we reduced rates because it's a mathematical formula. It's an index that is spelled out in the contract. And because of some lowering of the CPI and or the fuel, again, we actually had years in which there was a rate reduction. So we've continued to follow the contractual obligations of the contract. So I just wanted to make that clear.
Okay, all right, thank you, and that's an important point. Any other public comment?
Members of the public who wish to speak on this item, please press star 9 or the raise your hand icon. We have no more public comment.
Okay, if there's no more public comment, I'm going to close the public hearing and bring it back to the board, and I think that's, go ahead, Supervisor Medina.
I just want to state one thing, and correct me if I'm wrong, legal counsel, is residential, they must use Recology. They don't have an option. Whereas businesses, they have an option to use other waste management firms. Is that correct?
I believe that's correct. I'll defer to Kathleen because it may be residential. I'll defer to Kathleen about residential out in the country.
I'm more worried about business. Business
yeah.
have the opportunity to use other management companies.
I believe that that's correct. Kathleen, you can correct me if I'm incorrect.
Yeah, if I could recall off the top of my head, and this is off the top of my head, we were concerned about the recycling and the green waste.
Yes, and that's what I just wanted to mention is, you know, when you're looking at the increase in businesses versus residential, the residential is less, of course, but the businesses, they have the opportunity, they have the option to go to a different company, and that was one of the things I looked at when I looked at the contract, when I was one of the ones that voted on it, and that's why I looked at it in that manner.
Yeah.
And if I may respond, Supervisor Medina?
Yes, ma'am.
If I may respond?
Yes.
Great, thank you. Thank you for the question. The way the franchise agreement is written, and when we had the ad hoc committee with 2 members of Hollister, San Juan Bautista, and the Board of Supervisors, your recollection is correct. We were allowed, we were directed as part of the franchise agreement to allow competitive for the roll-off portion of the business. So meaning not the containers where the trucks are picked up, they're called front-end loader trucks. These are actually the roll-off containers where you'll see them at construction sites and so forth. So we were directed to ensure that the franchise agreement did not include these roll-off types of containers. I did want to clarify that the unincorporated, there are sections that are called discretionary that does allow other services to be provided. But the franchise hauler in the vast majority is Recology, and they do the collection, and they do the collection per the franchise agreement within the non-discretionary area.
Thank you. Yeah, thank you for that explanation too. And you know, working on this contract, it took a couple of years with a lot of meetings, and when we went out to an RFP, we've had a lot of, you know, this board, and I think the councils get accused of non-transparency all the time, it seems like, and it's been such a public process in our selection of this waste hauler, and it wasn't taken lightly. We leveled the playing field. They were the contractee before, but they needed to replace all their cans. They needed to comply with all the new state regulations that has been coming down the pike, and there's costs. And the bad guy is not just Recology, it's Sacramento and the new laws and requirements and airboard stuff that keeps coming out, and there's costs to that. And you know, we all have to, it's a set formula in the contract that, you know, protects them. You know, they are in it to make a little bit of money, and also protects, you know, the consumer. So, it's the best we could do, and I'm going to support this myself today and move on. Any other comments from the board?
Yeah, Mr. Chair, I've been struggling on this one because I know that I agree with everything you said. I agree with the fact that it's market rate, right? They base it off of the cost, so what is it, the consumer price index? Gas prices, all that. All that being said, and I'm obviously supportive of business, this is still taxpayer funded to a certain extent. And I struggle putting burden on the people when everybody's struggling. And I feel like there's a lot of people giving concessions, even giving away their lives. I feel like Recology could do better. So I struggle to support something that's not, it's gonna make their bottom line equal. And I completely agree. I'm just as frustrated with Sacramento that all they do is make life harder for everybody because they come up with these ideas on how to, protect the environment. It's always on the backs of the people. And it's only getting harder and harder. So, there's ways to do it. I really believe local level government is better because it's directly connected to the problem. It's not, it's farther removed for the state. So it's more idea making. But yeah, I think in general, I have a hard time supporting something that's, and that's gonna make their life equal when lives are equal right now. I think we need to do what we can to sustain our community, and I don't think this is gonna help it.
Okay, thank you. Supervisor Medina?
Just one more thing. I completely agree with Peter, but unfortunately, a contract is a contract. We were able to, move the goalpost a little bit on the backs of not an individual person paying $1.50 or $3 a month, but on the entire county paying that difference. But once again, it's a contract. It's a breach of contract if we don't agree with this. So, I have to accept this, and I would definitely vote for the contract.
Okay, and, in all reality too, the county we allocated CARES Act money to our lower income people to help with rent and utilities, and we're trying to get through this all together, but with that, I'll make a motion that we adopt a resolution approving the solid waste collection rates for January 1, 2021 to June 30th, 2021.
A second.
Okay, I have a first and a second. All those in favor say aye.
Aye.
Aye. Pose?
No.
2 to 1. Passes.
No.
No?
I'm sorry.
Gotta
You
be
need to
majority.
continue it to the next
We'll
meeting.
continue to the 15th. It's got to be majority.
Oh, okay. We'll have to continue the item. We'll continue the item.
Could there be a motion for that? Could there be a motion for the continuance
Yeah,
till the December 15th at 9 o'clock?
December 15th, 9 o'clock then. Okay.
That's correct, right? Yeah.
So we'll go on to the second.
Is there a motion? I'm sorry. Is
Pardon
there
me?
vote on?
I'll make a motion to continue this item until December 15th at 9 a.m.
Have a second?
Second.
Second. Okay. All those in favor say aye.
Aye.
Pose? Okay. The items continue to the next meeting. Okay. Move on to the next public hearing. That would be Director Young.
Mr. Chair, members of the board, Mr. Espinosa, we have an update to the affordable housing regulations that scheduled for another public hearing today, and Jamila will summarize that for you. With your indulgence, she has a PowerPoint that we would like to move through as quickly as we can. that provides relevant background information for this item.
Great.
Good morning, board and members of the public. And I just share screen, correct? Yeah. Okay, this is where I need the technical help. Thank you. I appreciate your help. Good morning, board members of staff and public as well. So today, like we had introduced in the regular agenda item, we do have before you a public hearing item related to amendments to our affordable housing ordinance, which is chapter 21.03. Today, I'm just going to give a little bit of history about the item, the purpose for the amendments, our timeline, and then the obvious comparison of the changes. So just to give you a little bit of history, our current ordinance was adopted in September of 2016. In the fall of 2019, we had established an ad hoc committee to clarify and complete sections of the ordinance. The ad hoc committee consisted of 2 members of our Board of Supervisors, 2 members of our Planning Commission, and we did have regular attendance from members of the public. And the fall of 2019, we also did contract with Venancio Wolf Associates. They were able to help as a consultant to review the ordinance, but also complete an affordable housing gap analysis, and will be completing a feasibility study. And then now, in the fall of 2020, we are going to be reviewing these amendments. Again, the purpose of these amendments is to help clarify and review sections of the ordinance. In your packet today, we have our staff report. We previously reviewed the bylaws, and then we have our resolution as well. You will see in our timeline, we have accomplished a lot already. We had it reviewed by Planning Commission. It was publicly noticed in the paper, and then now today we are reviewing it at the Board of Supervisors, which later we will have a 30-day review period. One of the first sections that we are amending is expanding the definition for the ordinance to clearly state for sale and rental units. One of the other sections, which is under this resale restriction and shared equity recapture, is also indicating that if there is a type of federal grant that we receive, that we can be able to create a shared equity agreement instead of just a resale agreement. This has come up with our Riverview 2 estates example, where we won't necessarily be able to have resale restrictions, but we will have a shared equity agreement with the new homeowners. Next, we will also include language to indicate extremely low. So in the current ordinance as written, it doesn't give us enough flexibility to be able to use potential in lieu fees for the various types of income categories. So we wanted to include the income category of extremely low. So in the future, if there are projects that need financial assistance, that we can be able to use it for more of those income categories. Next, one of the proposed amendments related to on-site units is to remove the language which states that 50% of the inclusionary units must be 3 bedrooms. In addition, the proposed amendment is to remove the minimum square footage related to those bedroom sizes. And instead, the proposal is to add language which indicates that the minimum size should not be less than 80% of the average size of the market rate units for both rental and ownership units. Thank you. And this is just a breakdown of how the current ordinance is written on the left and the proposed amendments on the right. So again, we would be removing the statement that 50% of the 3-bedroom units, or that minimum of 50% that are built have to be 3-bedroom, and then removing the square footage minimums and indicating that 80% of the average market rate is what the size should be for an on-site inclusionary unit. The next section to the amendments is related to, again, on-site units. The goal is to maintain the on-site requirement as 15%, but again, expanding that definition to for developers to be able to provide rental and for sale units. There will now be an expansion to the tables in the ordinance. So for for sale units, we will target the 15% to include 10% mandatory to include moderate income units, 5% for low-income units. Then next, the rental target for the lower income households will be 5% median income, 5% low income, and then 5% very low income. And so this table just includes what's written in the current ordinance. So what's written in the current ordinance is that if a development is requesting to build in San Benito County, that they're expected to build 15% of moderate, low, and very low units. But at this time, we are proposing to change it slightly. And that change would show here, where we would have it be just for moderate and low income units for ownership units only. So this is where the individual would be purchasing the home. The next slide is for on-site rental units, where we would expand to include very low, median, and low income, but have the emphasis be on more units towards the lower income or the very low income category. Next, one of the amendments is related to the off-site affordable units. We will still be maintaining the requirement and the request to have it be 20% for off-site areas, but what it will do and how it will break down, again, is a little bit different. So again, we will have the tables will show in the next slide. And so this is how it's currently written for off-site, is that 8% are required for ownership units to be moderate, 6% low for ownership units, and 6% for very low. But what we would be proposing, again, is to match the on-site, which is it would just be for moderate and low income households. So 12% would be for moderate units, and 8% would be for low income units. Again, this is for if a development is requesting to build off-site affordable units. And the next is related to the proposed amendment changes with off-site rental requirements. Again, focusing on the very low income category and the lower income category, and having that be 5% very low, 10% low, and 5% median income categories. One of the topics that we also discussed in our ad hoc committee is the terms of affordability. So meaning how long is this unit restricted for to maintain that type of affordability for future homeowners or for future renters. So we have requested to maintain the for sale as a minimum of a 30-year requirement, and for rental units to have the length of affordability for a minimum of 55 years. And next, which you have already seen in our regular agenda, which was passed, is increasing our number of members of the public as part of our advisory committee. So this is also written in the ordinance. And next, one of the last requests or proposed amendments to the ordinance is to be able to remove language related to impact fees. So what's currently written is that if a development is 100% affordable and is being built within San Benito County, that they receive a reduction of impact fees. What the current proposal from the ad hoc committee and approved by the Planning Commission is to remove the language and provide no incentive to 100% affordable development, and further no incentive to any type of affordable development to have a reduction of impact fees. This was a discussion item at Planning Commission that they wanted to elaborate here at the board as well to determine if that's something that we'd want to maintain. But the proposed item again is to remove the language and provide no reduction of impact fees for affordable units or 100% affordable development. And one thing that we also included within our proposed amendments is to expand inclusionary requirements. So what is currently written is it doesn't give much clarification to the type of home that a developer could build, obviously based on zoning and different regulations, but we wanted to expand the idea of it to go beyond just a single family home, that it could be townhomes, duplexes, different types of variety, and to be able to clarify that within our ordinance. And lastly, one of the, or next to last amendments that we wanted to change is what's currently written in the ordinance is that 1 to 4 units do not have to provide any type of affordable requirement. And when it gets to 5 and to 6 units, the development is expected to pay a type of in lieu fee. And once it reaches 7 or more units, they're expected to build on-site affordable housing. The proposed amendment from the ad hoc and then CNET Planning Commission is to have it be effective the 11th unit. So if a development that is being proposed is 1 to 10 units, they do not have to provide on-site and they do not have to pay an in lieu fee. What happens is at effective a development of 11 or more, we'll have to provide on-site units and or other options seen before the Board of Supervisors. One thing that we will also be adding is language into the ordinance so that if and when we do provide the in lieu fee, that it will just be part of our master fee schedule to help streamline our fees and what type of schedule we provide to the public and to the board. So when you adopt a fee schedule with the Resource Management Agency, the in lieu fee will be part of that master schedule so that we don't have to come every single year to amend the ordinance. The fee will not be part of the ordinance. It'll just be tied to our master fee schedule, so we don't have to constantly make amendments to our ordinance. Another thing that we wanted to add is what's currently written in the ordinance is the fee to be determined, basically. And so what we have proposed as part of our public hearing is to have the fee be tied to a construction cost so that we can be able to adjust the fee as needed. So in the future, if construction costs do greatly increase, then we can adjust the fee accordingly, obviously approved by the Board of Supervisors. Next, we would also like to, and what's still written, but one thing that we do want to address is that in the ordinance, it does request for a 5-year review study. So every 5 years, be able to review the ordinance, determine is it working for our county, is it working for our agency, and if there are any changes that are needed as well. Next, just a few items that we wanted to be able to highlight is the option for a developer to provide other compliance options when it comes to the in lieu fee. So if they want to provide a combination of on-site, but also providing in lieu fees, that they can be able to do a combination of the two. And to continue to ensure that our homeowners and our renters are seen and following the rules, basically, is that we will continue to have monitoring efforts. So that is part of my job and part of our role. We do have about 50 units within the county that are currently have to follow resale restrictions, and so that is my responsibility to ensure that they are following what is written in the resale restrictions. So this would just be expanded to include both homeownership and rental now moving forward. And I know that was a lot to digest, especially with,
you know,
with our meeting.
This is a lot of information, and the committee has worked so hard. You've been working so hard for quite some time. We've been anxious to get this back to us, and it looks like we've made a lot of progress. And I have, one of the questions I have is, how did the committee decide on the inclusionary tables, like the size of development of 1 through 4, or why not have a fee for them as well? It's not like I'm buy a parcel, put my house on it. We're talking about developers splitting and putting in their ranchettes. Why not charge them the fee as well?
That was a really great question, and that came up a lot and multiple times. And I believe Supervisor Medina had his hand raised that he just wanted to expand as one of our ad hoc committee members.
Yeah, just for transparency purposes, the committee was made up of Robert Eggers, who is the D3 or District 3 Planning Commissioner, Robert Gibson, District 4, myself, and Jaime de la Cruz. And at all times, the public was involved and they were allowed to participate. On that one, Supervisor BOTELHO, what we looked at was large developers versus smaller developers that are more a benefit to us in town, because a lot of the smaller people, 10 or less houses that they build, they purchase a lot of their materials from here, from McKenna Lumber, from Ace Hardware, from Forest Products. So what we felt was if we gave them an incentive somewhat to build local, your smaller developers, because 10 homes isn't a large developer. It's with all due respect, it's the mom and pop people that are building. So that's when we looked at that. We said, well, I think it'd be wise to keep it at that level. So that's why we decided to do it 10 and below.
Another question I have, and I don't know if you had this discussion in the committees, because you guys work a lot on this. I could just tell. I get concerned about, even those small developments, 4, 5, 10 units. How do we prevent that from being out in the unincorporated areas? This is one thing, believe it or not, I did agree quite a bit with my, successor is that, growth pretty much should occur in and around the cities. So, and those projects would probably be annexed in to the city. Is this going to be an ordinance that is going to be jointly shared with the city as far as the mitigations and partnerships as far as providing affordable housing and discourage those type of splits out in the agricultural areas?
Well, for me personally, there's an answer. We will let Mela answer it also, but what I'm looking at is, I believe if it's, correct me if I'm wrong, legal counsel or Mr. Young, if it's 5 or more units, they have to go through it would be a subdivision, which they have to go through an EIR, or CEQA, I'm sorry. Am I correct on that?
They would have to, what you're talking about is major subdivision.
Yeah, major
versus
subdivision.
Minor subdivision.
Minor subdivision is 5 and below, or 4 and below.
But you'd still have to do CEQA
Yes.
for minor subdivision as well. It just is the degree of
Yeah, so
CEQA
that comes to planning commission, so that kind of combats that. But as interacting with the city, I'll let Jim talk about that one, because I don't have the answer.
Yeah, that's a great question. Right now, the city of Hollister does not have an inclusionary style or affordable ordinance, but that is a plan. We did apply for state funding to be able to use it towards creating and developing an inclusionary housing ordinance. So, most people do say that if you have a county with an ordinance and then other cities, they should be pretty similar, or you do kind of face this, it could have issues when you have developers might want to go here, but instead of here. So it will be something that we will have to work together, and I think that's helpful that I do work with both. But that is correct. At this point, there aren't any steps that dictate the city to provide or to follow this ordinance. So that is just something that it would have to follow the regular processes, even, with CEQA, EIR, or even, through LAFCO as well. So at this time, there isn't necessarily a boundary that says or stops this kind of city-county connection, but it is in the process of having an inclusionary policy at the city.
Yeah, I just, when we created your position, we're jointly sharing the cost of your position, and I really hope that we're able to kind of address this really urgent need jointly and build on that relationship, and probably having something like this, a foundation for, the city to even look at, will probably do a lot of good.
Yeah, that's definitely a goal. We have some time to use the grant funding, but that was an application, or what we used or expected to use our grant funding for.
Thank you. Any other questions from the board before I open up the public hearing?
No, sir.
Okay. I'll open a public hearing. Anybody from the public?
Richard Betancourt, 4140 Southside Road. Robert Gibson and I have long discussions about what we're talking about right now. And over the years, it's really, how many affordable units have the county come up with? I mean, even in the housing element, that came before us, I don't know how many times over the years. There's plenty of land out there in the county, but the problem is water and sewer. So they always had to be next to the city. Sitting on LAFCO is a problem because we're mandated to protect prime ag land. And so you go and put a 10-unit affordable housing out in the county. If it ain't near the city sewer, then you got septic tanks. So that's a prime ag land problem because we're getting nitrates into the soil. So I don't, to me, it should be built in the cities, not in the county. I don't know what are the answers that you guys can come up with, but that's my comments.
Thank you. Anyone else?
Hi, Colin Kosmicki, County resident, incoming District 2 Supervisor. I appreciate all the hard work. This is obviously a big topic. I think everybody here appreciates the need for affordable housing. We have a crisis here in San Benito County. We need more affordable housing. And first off, what I'd like to suggest is that I'd like to recommend that we put this off. You have 3 new board members coming on, 3 new planning commissioners presumably coming on, and this is a big, big topic. I don't know if there's from a policy perspective, I don't know if there's a bigger topic than affordable housing. And so I would just respectfully request that you put this off so the new board can consider these changes. I just think major policy changes like this right before a change of leadership doesn't really work well. I, for one, am going to be bringing this up right away again. I can tell you that if you approve this ordinance, because there are flaws. Unfortunately, I think this ordinance loosens the affordable housing restrictions. I see that we're getting rid of the incentives for developers to build 100% affordable by getting rid of the impact fees involved. And I see that we're increasing the number of units, 1 to 10. So I don't understand, frankly, why we increased to 10 units as far as having to start to pay these in lieu fees. And I'll also say that we have to ask ourselves a bigger question here. What are we trying to accomplish with this ordinance? And again, I appreciate there was a lot of dialogue, a lot of people involved here with this ordinance, but what are we really trying to accomplish? Are we really serious about addressing perhaps the biggest crisis in our county, which is affordable housing? Or are we just, doing whatever we think is best for the development community? And so I just, again, please ask that you at least put this off so that we can have this discussion in a couple months as opposed to, and again, I know there was a lot of work done in the last year plus on this issue, but you do have 3 new board members coming on and 3 new planning commissioners, and I appreciate your time greatly. Thank you.
Thank you.
Good afternoon. Bob Tiffany, incoming supervisor. I would agree with much of what Colin just said. I think this is a huge issue. Affordable housing in general for our community is a huge issue, of course. Affordable housing is critical, and we need a much better mix within our county and our cities. So I would agree. I think this is a subject that probably should be put off until the incoming supervisors come in. Although it does look that a tremendous amount of work was done on this. There's a lot I need to learn. There's 2 things in particular that I saw when looking at this. One is a question, and it has to do with what the mechanism is for a developer in terms of deciding whether it's a on-site affordable housing or off-site affordable housing or in lieu fees, and whether that is strictly driven by the developer or whether that's a decision that the Planning Commission and the Board of Supervisors play an active role in. The other point that I would like to raise, which caught my eye that Colin already mentioned, is I'm really perplexed as far as why the incentive for developers to build affordable housing was removed, or at least one of the incentives, by taking out the reduction of impact fees, which seems to me one of the major incentives for developers put in affordable housing. So that's, for me at least, a major concern. But once again, huge issue, and I hope that this is going to probably be discussed over the next several meetings and ultimately decided probably after the first of the year. Thank you.
Thank you. Anyone else from the public? Anyone online?
Members of the public who wish to speak on this item, please press star 9 or the raise your hand icon. We have no comment via Zoom at this time.
Okay, I'll close the public hearing and bring it back to the board. Personally, I've been waiting for this for years, and maybe another month or two won't make that much of a difference. I really don't mind letting the new board take the lead on it, especially with this board being so short and not, having 5 members here. This is a real important issue. I was hoping we would have had this before that all those projects on Southside Road were kind of going forward. I don't see there's a lot of new projects that's in the books that are coming through that this would impact right now anyway. At least I don't think so. And for it to kind of hold off and have a little bit more discussion. Supervisor Medina?
Yeah, well, I spent a year on this, and even Colin was at some of these meetings, and nothing came up of this. So I'm a little bit perplexed. Where you had your time, it was public, and I think I emailed you several times and texted you several times when the meetings were. Ms. Gonzalez, same thing. Do we kick the can down the road? Well, I'll tell you right now, if we kick the can down the road, it's not going to be a month. It's going to be about another year. That's the way it works. Because someone's not going to agree with one thing, someone else is not going to agree with one thing. It's going to go back to an ad hoc committee. You have Jaime, who will be no longer with us. So I'm ready just to make a motion and approve it as it is, because we did put a lot of time and effort into this, and we felt this was the best, and we asked for public input, and we actually did change some of the things because of the public was there. There were some people from what was it, South Valley Housing or some other housing agencies, community services. So it's, to me, it's up to the board here, but I'm gonna make a motion to go ahead and pass this.
Okay, so you're forming that in a motion then?
Well, unless Peter has any questions.
Supervisor Hernandez, you have any comments?
No, I mean, well, I would agree with Supervisor Medina. They did a lot of work. I don't want to dismiss the work. I understand the statement. I mean, technically it can come back anyways if there's amendments to be made. So it's not done deal.
Yeah.
But I don't want to dismiss the work that's already been done just the same.
I certainly want to be respectful of the new board coming in, but that's a correct comment that ordinances do come back, changes are made because you have to do it, and I do appreciate the work that Supervisor Chair De La Cruz and Medina have done, and it does take a lot of work, and it will, and I think Supervisor Medina's right, it will be another year. You just don't walk into it and understand it right off the get-go, and.
If you don't mind, I'll make a motion.
Go ahead.
Move to approve staff recommendation. Conduct a public hearing to consider Planning Commission recommendations and the adoption of an ordinance amending certain provisions of San Benito County Code, Chapter 21.03, Affordable Housing Regulations in San Benito County to include the following items. Additional of rental housing as an affordable housing type, including the term extremely low income. Include the commercial construction cost index to adjust in lieu fee annually. Replace minimum square footage for inclusionary housing with the percent. Amend for sale on the site units to 10% moderate, 5% low income. Amend rental on sites to 5% medium, 5% low, 5% very low income. Amend off-site to 5 very low income, 10% low income, 5% median. Terms of affordability for rental units subject to 55-year deed restriction. Update the Housing Advisory Committee to 7 members. Eliminate reduction of impact fees across all units. 2, adopt a draft ordinance amending San Benito County Code, Chapter 21.03, Affordable Housing Regulations, making 2035 general plan consistency findings and determinations, and making appropriate findings and determinations under the California Environmental Quality Act.
No, yeah, no.
That's it. That's my,
And the 4 and 5 too,
if a CEQA determination is made,
which it was in Exhibit A.
direct staff to post notice of exemption. If the ordinance is adopted, direct staff to publish a summary of the ordinance.
Okay, do I have a motion? Do I have a second?
Second.
All those in favor say aye.
Aye.
Oppose? Hearing none, motion passes. That concludes.
That was 3-0.
No.
3-0.
What's that?
I thought you said did you oppose?
Yeah, I voted.
Oh, but you voted for it or opposed?
Oh, for it.
Oh, okay, I'm sorry. I thought you opposed.
Yeah.
I thought you were doing a 2-1
No,
again.
no. It was, I could have gone either way.
I know,
but
I'm just saying, but I thought you were doing a 2-1, that's why.
No, 3-0. Okay, that concludes our regular agenda and public hearings, closed session. Barbara?
Okay, 25, closed session, conference with legal counsel, existing litigation, government code section 54956.9, subdivisions A and D1, name of case Frank Barragon versus County of San Benito Superior Court, case number CU 20-00121. 25, closed session, conference with legal counsel, anticipated litigation, significant exposure to litigation pursuant to subdivisions D2 and E2 of Government Code Section 54956.9, number of cases 1, facts and circumstances justifying closed session, potential litigation relating to November 13th, 2020 email received from Jonathan Weisglass representing Frank Barragon indicating a new case would be filed in the San Benito Superior Court on November 13th. It's my understanding that a new case has been filed, but we've not yet been provided with the case number on that case. And number 27, closed session, conference with labor negotiators, agency designated representatives Michael McDougall, Ray Espinosa, Edgar Nolasco, Stuart Petrie, Elvia Borosio, and Barbara Thompson, employee organization, institutions association, law enforcement management, employees groups, SCIU Local 521, general unit, employees, County Sheriff's Association, confidential employees, confidential management, appointed department heads, unrepresented employees pursuant to Government Code Section 54957.6.
Okay, good. Any public comment on the closed session items?
Public who wishes to speak on these items, please press star 9 or the raise your hand icon. We have no public comment.
Okay, we'll adjourn to closed session. Thank you very much.
Thanks.
Okay, we're back from closed session. County Counsel, anything poured out?
No reportable action.
Okay, entertain a motion for adjournment.
Adjournment?
Yeah.
Motion to adjourn. To our.
Okay, all in favor, aye.
Aye.
Next meeting, December 15th, the last meeting for Anthony and.